Good evening. This is the April 22nd, 2019 meeting in the Yarmouth Board of Health meeting. I hope all members of the board did some homework. We have a lot going on tonight. There's a lot of reading and really visiting 4 actual different sites in preparation for tonight. So hopefully everyone got to that. On the agenda, the first is public comment. If someone here would like to come forward and address any issue, really. Okay, let's move along. Number 2 here on the agenda is the National Prescription Drug Take-Back Day, which is Saturday, April 27th, 2019, from 10 a.m. to noon. Just by chance, is there someone here who's
No.
going to talk about it? No. Okay.
They weren't able to make it yet.
Right. So basically, what was in our packet was basically a turn-in unwanted medication flyer.
Yes.
That's what we had here. And it's essentially listing all the locations of the police stations. Ours here, of course, is at 1 Brad Erickson Way. It's important to keep in mind that they're open all the time. Okay, our police station, basically the box is in the lobby. You walk in, put your stuff there and walk out. No one's going to want to speak with you. If you want to speak with them, you can, but it's great. Just walk in and get rid of the stuff, which is fabulous. I don't know if there's anything else you want to say, Bruce.
That's fine.
Thank you, Bruce. Okay, good. Next, number 3, we have an update. Yarmouth Substance Awareness Committee. Oh my goodness, great. We have a speaker tonight. Yes. Please have a seat and introduce yourself for the record. And actually sign it. I'm going to get better at this.
Oh,
So you print your name.
okay. I will make sure I do
Our
that.
minutes, we get everyone's name correctly spelled.
And I will try to remember how to put all the letters in my name. I'm obviously Christine Greeley, and I am chair of the Yarmouth Substance Awareness Committee, also known as YSAC, which is a division of your Board of Health, actually. We sort of answer to you, although we were created by the Board of Selectmen. We've been very active for the last 5 years or so, and actually have received some very nice feedback and praise from various organizations that have resulted in our receiving two grants this year. The first one is from SAMHSA, which is the federal agency about youth and underage drinking, and that is a $750 grant that has been used to create PSAs, public service announcements, scripted by both the police chief of Yarmouth and of Dennis, in which they talk about the fact that if you're going to provide liquor to kids in your house and you're going to allow them to do that, we're going to bust you, and we're serious about it. And so it's a really great PSA. And during the course of that, Chief Fredrickson actually came up with the title for our grant, which was, "Don't be a cool parent, be a good parent." And so we really like that. Concurrently, Bruce and I have been members of the Regional Substance Awareness Council under the County Board of Health, County Division of Human Services. And as a consequence, we also have worked very closely with Jamie Bienda, who is the chief investigator on the Cape for the Alcohol Beverage Control Commission. And during the past year, we've worked on a project with him in which we developed the Cape Cod Parents Pledge, in which we've talked about developing statements that parents can make about not providing alcohol to kids in their household, to making sure that they're checking with other parents about the use of alcohol in homes with kids under 21, understanding that the social hosting law can have dire consequences to you as a parent or a provider of liquor to someone under 21, and also the idea that, check up, call. I mean, if you think that someone's child in your house has been drinking somewhere, call that other parent, let them know. And so we worked on that, and we finally finalized it. And I'm proud to announce that Yarmouth is going to be the first community on Cape Cod to actually implement the Parent Pledge. And the ABCC is actually very happy about that, too. And that's been done in the form of a PSA that's been filmed up in the Dennis Yarmouth Regional High School Public Library, High School Library, and it's really very powerful. There are half a dozen parents, men, women, they are saying and reading sections of the pledge and saying, "This is what I'm pledging to do." It will then be followed by Facebook. They'll be followed by various other social medias with the release of this. And the final thing is we have currently working with a group of students who are working on pledges of their own, of how to be cool and not have to drink and to do this. And this will all be tied in with the May event in which there's that major auto crash that's placed on the front lawn at DY High School, where they had the police talk about it and the implications, because one of the officers actually lost their daughter in a tragic accident involving alcohol. And so he's very committed to doing this. And so the whole rollout will be in the month of May. You will see it advertised as an event. It's part of what will happen under SAMHSA. Concurrently, we were then very lucky to apply for, and we were the only town on the Cape to receive the $5,000 grant from Barnstable County. And with that, we took a look at how could we impact the issues of drug use, alcohol use, and vaping, which is becoming a very, very serious issue in our public schools right now, particularly since they're putting marijuana oils into the vaping, and it's gotten to the point where it's really, really dangerous for kids, and we're very, very unhappy with how that's going with our under 21 population. So what we did was we designed a program because almost a third of the students who attend the tech school are from Dennis and Yarmouth. So we did a concurrent program. One will be based here at DY High School, in which there will be a senior week event for kids that will sponsor a lot of the, or show a lot of the PSAs that have been developed, and really have a theme about posters and other things like that, about the dangers of those activities of the drinking and the drugs and the vaping, and be a party for them, a substance-free party for the first time. So that's part of it. The other part of it is there's going to be a dinner for families at the regional technical high school, because they have the cafeteria capacity and the culinary capacity to do that, during which time we will have some speakers and really do some interactive kinds of things with families about the things that are going on. So we're very, very excited about this. All this will have to take place by June 30th, because those were our funding deadlines. But we're working with subcommittees now to do it. But it's very exciting because Yarmouth is the first community on the Cape doing many, many of these things. So it's kind of a nice, exciting kind of thing to come and bring forward to you. The other thing I want to mention to you is that in the last day or so, I have been receiving many, many pieces of correspondence from experts in this state about the issues of hemp, about the CBD oils and other things going on, and how there's a lot of end runs going around things with boards of health and with communities and the police departments. And my intention is to forward to both Bruce and to your chairman some of the information I've been getting. Chief Carmichael out of Walpole is one of the authors of a lot of the things going on, and I will make sure that you see it, because it does have implications to you as a Board of Health, and better understanding what's going on out there in the communities and where things are falling down in the state around a lot of the issues now that marijuana is legal for those over 21, I'll point out. I don't know if you have any questions or not. Okay.
Congratulations.
Thank you. I know, it's exciting.
I'd just like to, thank for Chris putting all this grant application together. It did come down at the last minute through the county, and Chris put a lot of time in putting it together and going through things. So it's a lot of work, and we're excited to get to 2 grants and then continue with working with both schools. And we'll probably be back at the Board of Health as part of the rollout at one of our meetings. The videos they're making are terrific.
Yeah.
We did get a chance to look at them at WISAC meeting.
Right. I think it's important. The other thing you should know is that Cape Tech, because I am on their school committee, installed at the beginning of the school year vaping detectors in the bathrooms. Our principal would say he could use a full-time principal assistant for dealing with it. The next thing that happened was that the little pods and things, the kids are using them. Remember, they're all under 18 in that building. They're being concealed in various things such as underwear, so that if they came out of the bathroom, they couldn't be found. Our school committee then voted a metal detector wand, and so the student has a choice to either produce, privately produce, whatever to set off the metal detector, or to have their parent arrive and have them be with their parent when they produce that. And also rewrote very, very comprehensive school committee policy that we passed immediately on what the policy is and what the punishments are for having various those products on your possession and using them during the school, both the vaping and marijuana oils. So it is getting to be significant. And I said concurrently, because I had retired from the Westwood schools, they had 2 major fire alarm procedures in their high school in the last month or so, where the whole school was evacuated in a multi-town fire call. It turns out that it had been vaping that had set off the fire alarms in the building. And they said they're looking at, oh, gee, what are we going to do? Are we going to get these vaping, detectors, or what are we going to do to prevent this from happening to us again? So it isn't just here in our town. It isn't here just on the Cape. It's everywhere right now. And I commend you as a Board of Health. I know that you've been trying to work on some of these issues, but it's clearly, being offered to kids under 21.
The monitors are very expensive, really expensive, I believe.
Yeah, exactly. It's a problem. So thank you very much, and keep up the good work.
Okay, thanks for coming in.
You too.
Okay, Independent House, update on abuse program. So, okay, nice to have live people, good.
Hello, thank you. Let me just fill this out. My name is Chris Morin, and I work at Independence House. I'm the Director of Prevention, Education, and Outreach. So I am before you again to give you some update information, but also to just present the issue of abuse. We both, our responsibilities overlap in the fact that we both want healthy citizens in our town. So besides the main service we have of counseling, we are charged with prevention. So I have no idea of all the responsibilities you have, but I'm here to keep the dialogue about prevention of abuse ongoing. Abuse affects mental and physical health of all individuals, and depression, anxiety, and stress are very common symptoms of effects of abuse, side effects of abuse, and which are often treated as mental health issues versus someone living with abuse. So silence is the main tool that keeps abuse alive, and by having more conversations, we can lessen the stigma and the shame that goes along with this epidemic. To speak to the prevalence of domestic and sexual violence here on the Cape and in Yarmouth, between January of 2017 and July of 2018, the DA's office had over 4,000 cases. They also served the islands, but had over 4,000 cases of domestic and sexual violence across their desks, and that was just the ones that got through the courts. Here in Yarmouth, between January and December of 2015, the Yarmouth Police reported on 579 calls and cases of domestic and sexual violence, primarily I believe it was about 430 of those were between the ages of 18 and 59. But tonight, to talk about how the abuse of individuals affects the whole community is a whole entire another discussion, but many people still treat this as a silo health issue versus realizing how much it does affect the community. So our goal in Independence House is really getting community people and members and organizations involved. So just tonight wanted to briefly mention one of our major campaigns in addressing prevention. It's the Enough Abuse campaign, which is the prevention of child sexual abuse, and I have been before you before to mention this, but it's worth talking about it a lot. So we are part of a coalition that are trained trainers that bring presentations to organizations, agencies, any community member, faith communities, basically anybody who would listen, about the 3 major pieces of why is it a public health problem, what keeps it a secret, and what can we all do as community members. Basically, right now in our culture, we have changed, and the prevention piece is really, we've taught our children the correct names of body parts, who to trust, who to tell if something happens. But that puts the burden of disclosing on the child, and they have enough to deal with. The grooming of children is very manipulated and planned out, and they're given many messages of why they shouldn't, tell somebody. Excuse me. These presentations that we've given, unless they're mandated, mainly by an organization and its staff training, the turnout is pretty low. And again, one of the things that we think about is just it's a very tough subject to talk about. But we really do need to pay attention to our children and youth. When we do get called, it's after disclosure. So you might remember a couple years ago in Yarmouth schools, there was a teacher was in the paper about a relationship they had with a 16-year-old, and then I think last year in Brewster there was a teacher disclosed about abuse of young children. And that's when we get called, after the crisis. So this KISS campaign is really educating around looking at those signs that would prevent unhealthy boundaries by adults. So I guess I'm here to let you know that this campaign is alive. If there are ways that the Board of Health would be able to help us spread this word, or join us in working together. I don't have exact strategies, not knowing exactly everything that you do. So again, my role here tonight is to, again, just bring this to your attention, keep the conversation alive, and realize that it is really quite an epidemic around the world, and especially here in the United States. And, we have our own little paradise here, which has the same problems of any other, town. So, any questions or
Anybody? Comments, questions,
statements,
statements?
concerns?
Yeah, no, it's helpful. There are people who are listening, so I think it's good with what you're doing, being here. People watching the session, so try to spread the word a little bit.
Yeah.
Thank you for keeping us up to date. By the way, it's helpful. Thank you for having all the references to sources on the materials you sent, to know where it's all coming from, what journals and all. That's
Right,
not everyone
right.
does that.
Right.
Is there information online about the Enough Abuse campaign?
Yes, we have it on the Independence House website, but also enoughabuse.org. It's actually came out of Massachusetts from Mass Kids is the statewide child advocacy organization, and Jetta Bernier, the director, sought funds from the CDC in 2002, and so it's been going since then. So yes, there's resources there, all the different cities in Massachusetts, what they're doing, and that kind of thing. So thank you.
Just for the people at home, can you just give a little background on Independence House itself? I know you've come to our meeting.
Oh,
and we
sure.
work with you quite a bit, but all the other various programs that you work with?
Oh, sure, thanks. So Independence House serves all survivors and their family members who are experienced or have experienced domestic and sexual violence. We serve all people, no matter what. No insurance is needed. It's totally free. Our hotline number is 800-439-6507, and it's a confidential hotline, so anybody with a question or wants to figure out what to do can call. If you want to come in, we schedule an appointment. We have a 24-hour hotline. We have 24-hour advocacy that goes to the hospital if there's a sexual assault case. And then children who witness violence, we know that children who witness it has the same negative effects as if somebody was directly abused. So we have child counselors. We have a teen program. We know teens probably won't pick up the phone or walk in the door. So we have a designated teen website and a chat room, which basically can serve as a hotline. but to ask questions. We have blogs. We also, in our prevention work, are in the high schools with prevention, healthy education, healthy relationship curriculum called Mentors in Violence Prevention. And actually, the latest update is here in DY. We are working with the Principal Toni Morrison and Director of Athletics Paul Funk to create a curriculum. They want to integrate a curriculum, healthy relationships, into the athletic program. So that's a new place where we've gone, and actually where we want to be in the sense of working with a larger group. The sports world in general, I'll just say in general, are one of the most perpetrators of demeaning women. And so just really delighted with the Director of Athletics, Paul Funk, wanting to go forward with this and be part of their athletic program. So I think that's about it. Yeah. Okay. Thank you very much.
Thank you.
Thank you.
Okay, next on the agenda is the Duffy Health Center, Hyannis. Director Murphy. What's up?
Yes, we have a couple people from Duffy. We have our navigator, Edie Sampson's right here. Well, she's been before us, the board, our navigator coach for assistance with people recovering and looking for substance abuse services. And with her, we have a new person from Duffy, Daniel Rodriguez, Director of Substance Use Disorder Services, that will explain working with Edie now and how we're going to expand our program to get out into the public more.
First and foremost, thank you guys for having us this evening. And just to also say with folks in the room, I want to appreciate the work that Independence House and YSAC are doing. Without this pivotal team that we have behind us, Duffy Center as a whole wouldn't be able to operate in the capacity that we do. So thank you for all the folks that are here today. And also, just in advance, we're going to apologize after we speak. We're going to have to excuse ourselves just because we have an additional meeting to get to this evening. So again, thank you for the opportunity of coming ahead of you. So again, I'm Daniel Rodriguez. I'm the Associate Director of Substance Use Disorder Services at Duffy Health Center, and with me is Miss Edith Sampson, who is one of our recovery support navigators and is specifically working with the Yarmouth District, Bruce, Amy, and the team, trying to engage the folks that you have residing here in Yarmouth. And just to speak maybe from the beginning for folks who may either be in the room or at home, to let you folks know a little bit about the Duffy Health Center is that we are a federally qualified health center operating in Hyannis. We work very closely to provide integrative care for all of the clients that we serve. The majority of those clients are, pretty much all of them are Medicaid or Medicare. We serve some of the most vulnerable populations on Cape Cod, and some of the services that we provide under our roof include medical, behavioral health, medication-assisted treatment, so supporting folks with their substance use disorders through a variety of modalities. We also have created some new initiatives underneath the Duffy Health Center umbrella, which include women's health. With the AIDS support group of Cape Cod, we work to support any high-risk individual who comes in who may need HIV treatment, treatment of AIDS or any other transmittable diseases. And we are also, we have lots of grant funding opportunities, including our Moms Do Care project, which actually supports some of the folks that you have residing here in Yarmouth who are either pregnant or parenting, and providing them with wraparound resources such as a peer mentor, an outreach coordinator, and again, just being able to wrap all the services around them that they deserve transitioning into their parenthood. As I was saying, as part of the work that we're doing, Miss Edith has been working with you folks as the recovery support navigator, and as Bruce said, I know that she sat before you before. So what I'd like to do now is to transition over to Edie to talk a little bit about her current role, what's been happening since the last time she spoke to you, and then maybe hopefully open up the opportunity to talk about some possible ventures for the future.
Hi, thanks, Danny. I'm Edith Sampson, Recovery Support Navigator at Duffy Health Center. I know I've been here before, so most of you guys have heard from me already. Basically, what I do at Duffy Health Center is I offer navigation services for individuals in our medication-assisted treatment program, as well as really anyone who walks through the door that suffers from substance use disorder. So that sort of starts with a lot of crisis management, or navigation services to get these individuals connected with whatever services within Duffy and out in the community that they might need. And that really turns into long-term case management services as well. So anyone that I work with, I follow for whatever amount of time is appropriate. There is no time limit. There really aren't any boundaries as far as that goes. It's up to the individual need of the client, the individual that I'm working with. And as you know, I've been working with Yarmouth to try to work on our project. I know since the last time I've been here, I have been in several times with the Yarmouth Fire Department, several times with the Yarmouth Police Department to meet with our firefighters and our police officers to talk about sort of creating this comprehensive form of care and creating this community effort, and creating relationships so that, we're finding people when they're in acute need and in crisis, but making sure that they are connected with the resources that they need in the long term. I've also been to DY High School, spoke there with another navigator from Cape Cod Healthcare, which turned out really well. I'll be going back there in either May or June with, I've been working with Annie Catalano at the Yarmouth Police Department to work on this project with bringing all these different people in the town of Yarmouth into DY to let younger people know about what services are out there to work on some prevention and early intervention. So that's been going really well. And I know there are some things we're looking forward to in the future. This weekend, I'll actually be back at DY for their 5K that they're doing, which is great. I can have some continued presence there. And building relationships with Cape Cod Healthcare, with the hospital, been building relationships with the social workers there and the navigators there to make sure that when somebody's leaving the hospital that they are getting the continued care that they need. So there's been a lot going on, and we're trying to find more ways that we can show my face out in the community and get really more involved, specifically in the town of Yarmouth. So yeah, that's a update.
To piggyback off what Ms. Edith was sharing, part of the new process that we've been working with Bruce and Amy has really been around visibility. And as I said before, as being a federally qualified health center, I think the understanding in the community is that Duffy Health Center only services folks who meet the criteria for Mass Health or Medicaid. When the grant that you folks are supporting us with in this project really opens up the opportunity for us to serve any population, regardless of insurance, not insured. Anyone who resides here in Yarmouth is able to use Edith's services, right? So with a piece of this visibility campaign, it really is to deconstruct that thought process and to recognize that, again, Edie is available to serve anyone who is either at risk or in acute crisis related to their substance use disorder. One thing that Edie has done a phenomenal job with is really engaging folks in Yarmouth who truly have hit a moment of crisis where they are challenged with something, typically in the hospital, coming out of the hospital, or maybe working through some life-changing events, being asked to leave a household, really where there is, again, a crisis event that's happening. And what we're hoping to do is to eventually open up an opportunity, whether that be through the phone line that is already dedicated to Edith, or through an alternative means, maybe social media, some other digital platform, to be able to start to capture the group where they're not quite at a moment of crisis yet, and they are just looking for resources and support before they've, quote-unquote, hit their rock bottom or have hit a moment in time in their lives where they feel like stepping to a higher level of care is really important, right? When we talk about substance use disorder recovery, community-based treatment seems to be the most viable, and being able to support folks prior to a moment of crisis is hopefully where we can transition that to. So to, I guess, our request from folks here in the room as well as tuning in at home is that all opportunities that we can have as a team to really make ourselves visible again and to be present for you folks, that's what we're here for. And really being able to open up the opportunity to answer any questions that folks may have around substance use disorders, whether it be the person themselves that's struggling with this disease, or if it's a family member who's looking for supports or option or has questions about how to support a family member who may be struggling with addiction. We also want to be present to support those folks as well. Please, whatever we can do to better educate the community, that's what we'd like to do in tandem with Bruce and with Amy. So thank you. You folks have any questions or?
Have you spoken to the group that meets at the police station?
Learn to cope?
Yes.
Yes.
Learn to cope. Good.
Yes, I have been there.
Do you anticipate any changes based upon the season? In other words, school's going to be out, population goes up, activities, as the weather changes, they change as well? What happens in the summer?
I'm hoping that there will be more events that we can be present at and really, like Danny said, have some visibility out in the community. I think that there's certainly more activity. There's a higher population. And, you know, working in the substance use field as long as I have, I generally see an increase in sort of crisis behavior. You know, the warmer it gets, the kind of crazier it gets out there. So, yeah, I think that there's always a need, but I think, you know, I'm hoping that in the upcoming season that there will be more opportunity for me to kind of be out in the community more. And
Great.
right, yeah,
Thank you.
sure.
Anybody?
Want to discuss the pamphlets?
Go ahead. You want to? Go ahead.
There's pamphlets around town explaining the Duffy services and the services that the Yarmouth Board of Health is offering, that it's a direct phone line right to the office. So it's a grant that the Board of Selectmen provided through the Board of Health and through WISAC, our Substance Awareness Committee, to work with Duffy on this navigator, and we started in June, and we're very excited about the program, and we're getting out there more and more, and I think as we keep taking more steps and getting out the community is going to be very helpful. I've also met with the school also about trying to get them into events at the school. This weekend's a good one, so that will be our first event up at the school to pass out some items, and just keeping the Duffy name and the navigator and some of these out there that we can, flyers that we can, you know, just to keep engaging people around town. So
Great.
it's exciting.
Very.
Do you have navigators in other communities?
So right now, Yarmouth is the only community that is really, I believe, taking the initiative to connect and to have a specific navigator for themselves. Anyone who, again, as Edith was sharing, anyone that, regardless of what community you're from, if you are working with, as a client of Duffy Health, we provide those services to all residents. But no one is specifically bought into this particular model as much as the Yarmouth District has, and it really is a progressive model.
Right. Flyers are available at all the libraries, besides Town Hall. They're at all the libraries.
Okay. Good.
Good. Thank you.
Thank you again, folks.
Great. Okay, we're up to number 6, and this is a hearing. And it's 845 Route 28, to hearing for the Yarmouth Mini Mart. There's some violations that need to be addressed. Director Murphy, anything we should know before we proceed?
You have the information in front of you about the violation of the sale of, or violation of the board's tobacco regulations. You have a letter from the board to Minimart about the violation on March 7th by retail check by the Barnstable County Regional Tobacco Control at 10:45 in the morning, at which time there were e-cigarettes, blue e-cigarettes on the counter for self-serve. And there was also Phillies and Gamblers 20 packs for sale at $9.99, which is not in compliance with our regulation. This is the second offense within a 2-year period, so it's a $400 fine and a $7 half-day consecutive suspension according to our town regulations. You have the letter, you also have the inspection report from the county inspector, and the spreadsheet showing the dates of the past violation.
It's your turn.
So-
Okay, will you introduce yourselves? Thanks.
Thank you. My name is Edward Gilday. I'm a lawyer. I represent Mr. Basnet, and Mr. Basnet is...
Subodh Vasnit. I'm the owner.
Okay.
Yeah,
thanks for
I'm
coming in.
Matt.
Good.
So we, by way of background, would like to explain that Mr. Basnet operates 3 separate mini-marts in the Cape. He has one in Mashpee, he has one in Marston's Mills, and he has this one here in Yarmouth. Other than here in Yarmouth, he has no findings that he's violated any of the rules or regulations of the communities. He operates a very carefully constructed store. He has policies and procedures in place for his employees to follow. And in connection with the violations found in Yarmouth at this particular time, he is, as much as anything else, a victim of bad timing or of a moment in time when things weren't right. He had a delivery of materials that unfortunately come in a package that is a display package, which he has to break down and put into his own self-contained device. And the young lady who received the package put it next to the self-contained device and went on doing other things and didn't get it in the rack, the locked rack, in time because somebody came and inspected at that particular moment in time. Similarly, with the $1.99 cigars, there's a display in the back of the store that says cigars are $5, and they were transitioning the packs from one rack, putting a new price tag on them, and putting them in the second rack, and they hadn't finished moving them from one to the other at the moment that the advisor came in to inspect what was going on. I have a few pictures, but I didn't bring pictures for everybody because I didn't realize how many people were involved on the board. But I have a picture of the cigar display rack, which has the $5 price written on it very clearly. I brought a receipt from a shipping invoice to show you that the blue tech or blue device that was racked in the wrong place arrived at or about the time that the inspector came through the facility. We want to assure you that Mr. Basnet is very concerned about making sure that he operates in accordance with the rules and regulations. There's no intention to violate the rules. He's not trying to sell things other than is as permitted by the regulations of the town. And if you have any questions, we're happy to answer them.
Who's responsible for putting away the goods that you receive for selling in the store?
There's people who work, the girls who work.
So everybody that works in the store might have to put away things that come in at some point.
Yes.
Well,
So
in it-
how do they all know what the regulations are?
We train, but actually that time, that particular time the delivery comes, she put that blue cartridges right behind the plastic box, which when the box, we have to open and put them there. It wasn't on the front side, it was on the back side. So she tried to put the price and put them there, that's it. We're not trying to sell it. But we don't know, we cannot put right there, you know what I mean? She should put on the side and then do it, but it's a common mistake, so.
Are things received through like the back door? Does it come right in the front door in a box? How does,
Yeah,
that, how does that work?
It's a box, plastic box, has a door on the back.
No, no,
lock.
I mean when your delivery comes in.
Oh,
you-
the front door,
it comes in the front door.
front door.
So like it just sits out until somebody puts it
No,
away?
no, no.
No, it's in
The delivery trucks?
Sure.
Back door,
Okay.
sorry.
But in answer to your question, there are not a lot of people who work in a mini-mart. Part of the economy of a mini-mart is that it's not filled with a lot of staff to rack the shelves, and the cashier, who's in charge of bringing up the sales, is also the person who many times puts things away.
Right. So how many people are involved then?
We had 2 people working,
2, okay. So,
in the morning shift and evening shift.
right. So I'm talking, but just 2 people total in the whole store ever? I mean, is that all you have is 2 employees?
Yes.
Yes, okay. So only 2 people need to know the regulations?
Yes.
Yes.
Sometimes I work,
Mhm.
I know the things.
Right. I know. Okay. but
We want to make
top
sure,
of mind at that point for them, apparently.
we want to make sure that you don't misunderstand. We're not claiming that somebody didn't know the regulation.
Oh.
She knew the regulation, she knew they belonged in the rack, and she was in the process of putting them in the rack, but did not get them in the rack in a timely fashion.
And the cigars? What about them?
The cigars were in a display above the cash register, and they were being moved to one behind the register that had the $5 sign, and they were taking them down, they were putting new stickers on them, put them in the rack. They hadn't moved them from the top to the bottom in a timely fashion.
We have a picture here if you'd like to see it.
It just seems kind of careless for someone that knew the regulations to leave them on the counter and leave them up there, and instead of putting them down below out of sight and then working on them.
I can't disagree with you. It's something that happens. You're working the cash register, you're ringing things up, you're moving things around, you put it at the most convenient place.
Thoughts people have? So what's our responsibility tonight? What are our options here? This is the second offense, right? There was one on flavored tobacco, right, pretty recently? Right, this is the second violation?
Correct.
Yeah.
Let me mention the flavored tobacco. When the rules and regulation changed, we didn't know the flavor that was tobacco, the broken roof. So we could not figure it out. And before the violation happened from the health department, 2 or 3 visit, somebody from health department, they're already in there. So nobody says nothing about that things. And we didn't know about that, the container. And one day, oh, this is a flavored tobacco. And I says, I don't want to carry if it's flavor, but we didn't know that. But I paid the fine. I didn't discuss for anything for that. I says, all right, what's $300 I paid? But that comes with the second violation, so it's a mistake. We don't mean to sell it. We follow the whatever rules and regulation town has them. But that was a first time. We don't know what flavor we can sell, what flavor we don't sell. That's was the situation on that time.
I'm not totally clear on the cigar sales. On the inspection check, it says that they were priced at $1.99, and your sign shows that they're...
There's a $5. That was on, the Philly cigar.
Okay.
The Philly white, only one has a sticker like a $1.99.
Oh, okay, so the
And
individual package
individual-
said $1.99.
Only one. They're supposed to be put the $5 plus tax, but there's a price, and they forget. When you put the space change, place change.
So was it It was mislabeled?
It hadn't gotten the $5 sticker on it yet.
Okay. So how did it get the $1.99 sticker on it?
That was a previous before you change
Before the regulation went
regulation.
from
We sell for
$5
$1.99.
minimum.
That was a while ago.
That's a whole, yeah, that's a whole pack of cigar, yeah. That cigar doesn't sell that
Is
much.
that 4 years ago?
More.
Was it 2014, 15, whatever? Yeah, 14. Okay. So we didn't see that on the other inspections, I guess. Okay, someone want to make a decision? What do you want to do? Make a motion
The
here.
violation is just a label, it wasn't a sale?
Yeah, it wasn't sell.
Wasn't a sale,
No.
it's just the way it was labeled?
Right.
Yep.
Well, 2 violations,
Yeah,
the labeling
different
and then having cigarettes on the counter as a display and not behind the counter during the exhibition.
It was behind the display, but she tried to put in the display.
Does she
we
not have a
a-
key?
Sorry?
That was me. Does she not have a key?
No,
She
no.
not able
We have
to-
a key, but she put them right there when the inspector come.
The package comes in a display, so it's
Right.
packaged by the manufacturer to be
Sure.
a display. She put the display behind the locked container display and was supposed to be putting them off of one display into the locked container.
Right.
But she put it down, She went to work, and she didn't get back to putting them into the display
Right, I
in a
understand.
timely fashion.
It's not a, she put that whole things at the front of the counter, people can grab.
No, I
You know what I
understand.
mean? It was behind.
Retail store manager for 30 years. I know exactly what you're saying. What I'm saying is if it's coming in the back door, she shouldn't be bringing it out until she can put it in the case.
No, she bring it from,
No, I understand. I get it.
you know, sometimes happen, it's not a mean to
Believe
do
me,
it.
I know. I've been caught in audits before it happens.
You realize you're not alone. I mean, the health department is burdened to maintain and inspect all these stores, okay? They're selling tobacco, so it's a lot for the health department to take on. So, once again, someone make a motion so we can move along on this? We have a long list here on the agenda.
The motion is that we're finding?
Well, there's a fine, and if the second offense, there'd also be a suspension for 7 consecutive days, as I recall, for second violation, correct? Yeah. I mean, those are the regulations. That's not new stuff.
Well, I move that Yarmouth Mini Mart was in violation of our tobacco regulations, sorry, and because it was a second offense, they're ordered to pay a $400 fine, and their tobacco sales permit shall be suspended for 7 consecutive business days, starting tomorrow,
Okay.
April 23rd. Or?
Sometimes the board had asked, depending if they have a large shipment coming in, do you give them a few days or something? I did coordinate when a date would be.
You fine with that?
I'm fine with the 23rd.
This is a major concern about that, was what you're mentioning, just from the...
We've had that in the past, if they've had us.
I mean, is that,
It's-
do you need,
7 days with starting within the next
Right.
time.
We're trying to do something nice for you. The point is the next
Yeah.
couple of days is one day better to start, or if
yeah,
not,
do you
we'll
want
just
to
start
start
tomorrow.
Wednesday?
So you guys want 7 days
Yes,
suspended?
yes, it is. So that needs to start with the next couple of days. If there's no strong preference or you have a reason, we would just start tomorrow, which is what the motion is right now on the table.
Yeah, you can give us a couple of days.
So 24th?
Thursday to Thursday?
Friday to Friday?
It's okay, Thursday to Thursday.
Thursday to Thursday. It's the
Okay.
25th.
25th. Okay, is there a second to that motion?
Second.
Okay, discussion? None? All in favor for the motion, say aye.
Aye.
Aye. Charlie, was that an aye? Yes? Or not?
I don't know.
I didn't see you vote.
I just don't feel comfortable finding somebody that just had it, if it was a sale to a minor or a sale, but I'm not comfortable with, just being in the wrong place.
You can vote no. I mean, that's obviously,
No,
which is fine.
I'm not comfortable
No,
with
okay,
the fine,
so
no,
we-
not at all.
Okay, the motion passes, it's 4-1, I guess, then. Correct, everyone? Okay. All right, thanks for coming in.
Thank you.
Okay, try to tighten things up there.
Thank you.
Okay? Okay, unfortunately, there's another hearing. This, once again, on the tobacco front. This is a hearing for the business at 182 Old Townhouse Road, and it's the Townhouse News. Okay.
Hi, my name is Badris Patel. I'm the owner of the Townhouse News.
Okay.
Yes. Good evening, Chairman Matt Fitzsimmons. I'm the attorney for Bhadresh Patel and also Yajraj Corporation, which is the licensee.
Okay, great.
Yeah.
Thanks for coming in. Just 1 second. Anything you want to add to this?
I can just explain what you have in the packet, so they know and the people at home also know that, again, this was a compliance check by the county Cape Cod Regional Tobacco Control conducted on March 7th of this year at 11:22 in the morning, at which time they found the blue e-cigarettes on the counter for a self-service area. Again, this is their second offense, which would be a $400 fine and also a 7-day consecutive loss of license.
Okay. What details can you provide for us?
Certainly.
Okay, it's pretty straightforward, so.
Yes. Thank you, Chairman Bosky and members of the board, and Mr. Murphy. We come before you today on a violation cited on March 7th. My client is the owner and licensee of Townhouse News, 182 Old Townhouse Road, has been in business for 17 years at the location, and is also a license holder for A to Z Convenience on Route 28. And they had received a shipment, quite sizable shipment actually, as the season ramps up on the 6th, the day before. And at the time, the two individuals, husband and wife, who man the store majority of the time, Sunny and Usa Priyapati, that's Prejapati, who are the primary hour holders as far as working in the store. And the violation involves a sleeve of what are really wallet-sized boxes for e-cigarettes. The size is no bigger than your own wallet. A little bit smaller, actually, narrower, and in about the same length as a wallet. 9 to a pack. And at the time of the violation, both husband and wife were at the store. Mrs. Priyapati was behind the counter and assisting a customer. Prior to assisting that customer, she was entering in the SKU information, so the unit numbers, the actual code that the computer system uses to price and itemize for inventory purposes within the computer system. There are 2 kiosks at the store. She was standing behind the one at which the violation was found and had been assisting a customer. So she had the counter right next to, and on her side of the counter's about as deep as the table here. And she had the box about where my pad is right here with the cash register immediately next to it, assisting a customer who brought goods to the counter. And so it was a combination of having the responsibility of course, manning the store and the counter at the same time of working on entering the SKU information. One of the things that, in meeting with my client and both Mr. and Mrs. Priyapati at the store since the violation, one of the measures we've undertaken as far as an effort to mitigate this type of occurrence happening again is to have them use a tall stool that's lower than the grade of the counter, but right at the cash register, so that way they have the opportunity of still having the ability to be entering information, but have the product just off the counter here, rather than right at the edge of the counter. I have brought in photographs of the counter to show where the location of the box was sitting next to the cash register. I have 1, 2, 3, 4 copies, which I may share. Actually, 1, 2, 3 copies. Nope, that is 4, which I may share, if I may. I can take it, yeah.
That means you and I can wing it.
I'll share with Mary.
Yeah, thank you. Yeah, I happen to have 4 copies there. So thank you for sharing. As far as that mitigation, it really is an effort by having and the little circle there is just an identification of where the box had been located.
Oh, okay.
What they did, this just gives sort of a layout of how that counter is arranged, and the box just happened to have been right there at that location of where the mark is on the page, just to show the board, just to show you where the box was at the time. But she was in the process at the time of entering in the data for inventory purposes, and it just happens to be the way those sleeves come that they have to be individually entered into the computer system. And with it being a convenience store, it is sort of a multitask arrangement. But again, as far as mitigation, they really, as a staff, want to make sure that something like that doesn't happen again. And in doing so, having a tall stool behind the counter would be a way to solve that and mitigate that risk. We ask as far as relief, we really do. This is Mr. Patel's been in business there 17 years. This is a second violation. We really unfortunately had an incident approximately 2 years ago. But other than that occurrence, this is the only other time that we've had to come before the board. And in working with the staff and having his commitment in trying to mitigate the future risk, he would ask the board if at all possible for the understanding that paying a fine certainly is something that he understands is the risk this evening, but in terms of the 7-day suspension, that given that the type of incident really occurred in a way that to staff was unexpected, and given the other clean slate that they've had during this recent inspection, they would ask that the court not seek a 7-day suspension.
So were these still in the sleeves, or were they out of the sleeves?
Yes, it is the box sleeve, and so it has a SKU number or product number that they then enter into the computer system with a numeric of 9, so as to indicate that they've brought in 9 individual boxes within that sleeve. And then that sleeve then gets replaced into a locked cabinet that is also on the back side of the counter, or toward the back side. That's a locked display, clear on the front, covered in the back, and that's a locked display. So after entry of that sleeve then goes into either the bottom of the cabinet or individually if they need to unpack it for individual items if they're to that.
And when people come in, they buy an individual package?
Just one of the 9 from the sleeve, right?
So they were still in the sleeve on the counter?
Not right now, no.
No, was it an
The
open?
inspector came in, were they in the sleeve on the counter? Or,
The sleeve, yeah, the sleeve, and it's in as a whole sleeve.
If we have the delivery coming before the day, you know.
and there's 9 in a sleeve?
9-inch sleeve, new item coming, that's a new item,
And how many of those came in? How many sleeves came in?
just one sleeve.
This one's
One sleeve is 9 inside. We have a UPC, we have the computer system in register, we put in system.
right, the inventory.
Yeah,
Yeah.
inventory and sale and UPC number.
Yeah. To give the board an idea of scale, and I had my client share with me that it would be okay to do so, he actually brought the entire invoice shipping list that came in.
Right.
And essentially, when we look at the amount of product, it was over $11,000 of product, which for a convenience store, the number of items, if we went through here, it's hundreds and hundreds of individual items.
Right.
But I mentioned that for scale, just because within that 24-hour period, they had everything in compliance for the inspection, except for what is alleged as this one violation of that carton on the counter. So just as an idea of scale of how much inventory they have to work through within that short period of time.
It seems like in both this instance and with the previous store, the underlying problem is that the product ends up being on the counter
While it's being worked on.
while being worked on. And so, I mean, I applaud the effort to work on a different surface, whether it's a cart or a stool or
Right.
whatever it might be. I don't know does it have to be out of sight if it's on a cart or something behind the counter?
Well, if it's self-service, you'd have to be able to reach for it and say, well, I'd like to buy this, right? And
It has
that
to
would
be
be
behind
it.
the counter,
Yeah, so,
not self-service.
Right.
so it's
But
not
it can't
something
be
you can
on
reach
the
for.
counter. 'Cause
Right.
That's the
Right.
That's,
issue.
and with the cash register there, that was one of the other things we actually talked about, is just another idea for mitigation that I had was, can a screen be used? Almost like how almost like if you're at the registry of motor vehicles and that counter or at a bank and that kiosk is closed,
Right.
that the screen is used. Is that adequate? And it could be, if the board suggested that would be another way to mitigate the risk that while entering any product. But the idea as staff, given the layout of the store and the like, using a tall stool but behind the counter as a way to visualize, still see the SKU number, see the product, but not have it on the counter and limit that reach to that sleeve at the time that it's entered into the computer system, which of course the registers are right there on the counter. So that's the solution there.
The woman who was cashiering and also entering into inventory, was she the only employee there?
No, husband, wife, those two, and I'm working sometime too, and my wife working too.
But I mean, at that time, was she the only?
She's there
employee?
too. No, both of them is there.
Both
Husband
was-
and wife.
Yeah, we have a delivery coming, that's why, they just check it out one by one and install the item.
When you receive the delivery, do you check it to the manifest?
What do you say?
When you receive the delivery, do you check it to the whatever
Yeah,
invoice?
items.
Yeah,
Yeah.
okay. And so,
So-
no, I understand. But I guess my question is, so the package, is the UPC on that piece of
Yeah,
paper?
yeah.
So you could get the UPC off of that. You don't necessarily need to have the product on the
We
counter.
need a product same time too. Is a UPC, they not put UPC number here.
There's no UPCs on there?
No, they're not
Okay, that was
UPC
my
number.
question.
Only
Oh,
that
I
they
see.
put
Got it.
item number and name.
Okay, but not the
UPC
UPC.
is coming, the barcode in behind, we want to scan.
Sure.
And we want to enter the
I
stuff.
understand. Okay, thank you.
I move that we find that the Old Townhouse Road Townhouse News store was in violation, and they're ordered to pay a fine of $400, but I would suspend the 7 consecutive business days, not require
Right.
a suspension for the 7 consecutive business days.
Second to that motion?
Second.
Okay, any discussion about this? Anyone? No? All in favor of the motion, just raise your hand actually and say aye.
Aye.
Aye. Okay, unanimous. So, violation is $400 and you are not going to be suspended for 7 days.
Thank you.
So, okay?
Thank you very much.
Fix the problem, okay?
But I just
Thank
want
you
to
very
be
much.
clear, that's fine. Is this considered a violation, though, for the file? So if something
Yes.
happens?
Yes.
Oh,
It would be the
absolutely.
third
Oh, yes, it's the
violation.
second violation, period.
Right. So if something happens again, it's a third violation for 30 days, so it's still counted as a violation, so
It's okay.
want to be clear on that.
Yeah. Thanks, Bruce.
Did you bring a check with you?
Yeah.
Did we hear that you had a?
Thank you. Thank you very much.
Thank you.
Okay, take care. Okay. Next, for all the Board of Health members, just take a deep breath, let it out, in and out. Okay, let's start. Next. Number 8, this is a hearing. It's the 5-Star Bus Company. They're located at 9 Commonwealth Avenue, South Yarmouth. If someone is here from that business, we're going to have you kind of come up, have a seat, just introduce yourselves, and inform us of what's going on with your business. Thank you.
Hello, Darren Lakrinsky with 5-Star Bus. Travis Stopa, 5-Star Bus.
You both work there, you're owners, who exactly are you?
Yeah, the management team, yep.
Management team.
Owners, everything. I'm one of the owners, so management team.
Okay, just print your names, that's just so we can keep the minutes correct. Thank you.
And we're here for tonight. We finally have our site plan review that was completed, signed off on, and we were told that we needed to wait to get our hazmat license. So we have not been doing any fluids or anything on site. We've had nothing on site. So that's why we're here tonight to discuss our quantities for our hazmat license for our oil and our waste oil, et cetera.
Well, we don't know anything, we really don't know very much about your business. Why don't you tell us about your business?
Okay, we provide school bus transportation for Dennis Yarmouth Public Schools. So home to school transportation, and so pick kids up, bring them to school, and bring them home from school, and we do charters and field trips.
I mean, I just Googled you. I mean, you do business all over the state, I think. I mean, you're a big
Yes.
company. So why don't you tell us? I mean, are there other towns on the Cape? What else?
We also do Barnstable out on the Cape. So
School system?
Yes.
Okay.
So we do all their transportation for them. And then we do the majority of our business out in Western Mass, part of the state.
How many buses do you utilize here and for DY?
So we have 40 total.
And do you have other locations on the Cape? I mean, what are
We have another location in Hyannis that we do all their buses. We have 51 buses over there.
Okay. What about the property? I mean, I know where it is. I went over and looked around.
Yeah, it was former Dr. Wheels.
Right.
Automotive shop. Purchased that in July, and we've been over trying to clean it up and and get it to a usable working space for the operation over there to maintain and take care of the vehicles and park the vehicles there.
Oh, I got you, understood. So basically, we maintain our own fleet of school buses. We're not retail facing, we're not public facing.
All right. When did you purchase the property?
The end of June of 18.
Okay. And,
Yeah, we've been going through a site plan review for the last 8 months.
okay.
And that finally got completed, March 22nd, it was signed off on. So we went through a bunch of different revisions and made a bunch of changes and worked with the town very closely with Carl and his department.
You have to understand that we don't, until 3 days ago, we didn't know you, I didn't, at least, and probably none of us didn't know you existed or the business, so.
Okay.
Just bear with us.
Sure.
Trying to put all this together. So you've been working on the property, it looks like, when I went by.
We've been,
A lot
yeah,
of-
our
lot
buses
of-
get maintained in Hyannis right now for oil changes and all that type of stuff. But right now, we've been parking out of the 9 Commonwealth Ave. Yep.
Okay. I'm doing all the talking. People have questions, just to.
I wondered, before you purchased the property, did you realize it was in an aquifer protection district?
Yes.
So you were aware of what that meant, what it entailed in terms of regulation?
Yeah, and it was all pre-existing, non-conforming stuff. We made sure we had to do all that before we could get bank loans and everything along those lines.
I mean, look, to me, you're enlarging the space significantly. You own the property right to White's Path?
Correct.
Right. Looking at it, you're increasing I mean, it's being leveled and it's,
Well, yeah.
I guess it's like 150% larger is what you're building there.
Yeah, well, we're increasing the size of the parking lot because of the size of the buses. For where the automotive parking was, for the repair side of things, I mean, the property was tremendously overgrown. You could see where the existing fence was. It was 30 feet into the woods. It had all been overgrown, so we're basically bringing it back to what its original size was, maybe slightly larger, but that front portion is actually going to be the employee parking. And we're getting rid of all of the on-street parking in the front of the building, and that's going to all be landscaped areas and stuff. So in order to create that parking, we had to open up the side lot next to the building.
The building itself, that footprint is staying the same?
Yeah. Yes. Yes.
Okay. So you would service the buses in that current building there?
Yes.
Yes.
So you have 2 full-size bays, 3, what's there?
Basically, well, there could technically be 3, but there's just 2 bays that we would access from the rear, the front.
Right.
Or 1 from the front and 1 from the rear of the building.
Right. I mean, it's a big investment you're making there, just, it looks like you're doing a lot of work already. I don't know, I just,
Yep. Yeah, I mean, we're looking to definitely improve kind of what was pre-existing there. We're looking to do the same thing as Dr. Wheels has done there since, I don't know how long that they've been there, but I know from the mid to late 80s. So we were told from them they had roughly 400 customers. So we're not going to be, but they're retail facing. You know, customers come in and come out. We basically just be running the drivers for the town of public schools of Dennis Yarmouth, and just maintaining our own fleet there.
But volume-wise, it looks as if it's going to be much bigger in terms of the hazardous materials that you'll be needing to use.
So, respectfully, I know when we went through and did walkthroughs when we were in there, I know that the team here was saying that they had on file that it was 800 gallons. When we did our walkthroughs before purchasing the building, I mean, they had 55-gallon drums everywhere, 275-gallon holding tanks. They had 2 of those on site. I mean, there are certain things that, you know, definitely would like to talk to the board about. I know with talking with Carl, he was advising us we needed to put onto our our total gallon quantity wise. So if we had we only need one 55-gallon drum of antifreeze, but because of the process of when that tank is almost empty, we would order another one so it would be delivered. Carl was advising us that we should put on there, we'd have to have, two 55-gallon drums, whereas we really wouldn't be having that on site. So just kind of looking for some advice how to go from that, because there's certain ways that we can talk about that. So just kind of looking for some feedback. But that's how we do it at every one of our facilities. So it's nothing that we don't do it. So we have one of our facilities that we run 115 buses out of, and we're using the same quantities as we have here. It's just kind of bulk purchasing. Stuff comes on site. It's easier for the vendors to make a trip out when it's bulk pricing. It's different when you start talking those smaller quantities. And so respectfully, when we look at these quantities, it's kind of roughly industry average stuff.
At the Hyannis facility, how does that compare? You're using, what, for 51 buses
It's the same exact ratio. We have yep, exactly.
How long is your contract for with DY?
It's currently for 5 years. And obviously, we're in it for the long run. We're a family-run business. Definitely want to continue forward.
What would happen if someone low bids you? In other words, it's the school system, you read the paper, money is the big issue, certainly in the school system. It's the front page recently, or every day in the Cape Cod Times, just about money. So what would happen then with your business if DUI decides to use a different, vendor?
Yeah, so then we would look to lease that to whatever vendor has the contract.
It says that you are proposing vehicle fueling in your materials.
That should have been.
Yeah, that should have been. We're not doing that.
How are you fueling the vehicles?
On-site fueling, so a truck comes and fuels up.
And where are the buses going to get washed? Where are you doing that?
We don't do any washing on site.
No, where?
Yep. We're not going to be washing them.
The rain, right?
Yep. Yeah.
Basically.
We don't, and any of our facilities, we don't do that. Yeah.
Okay.
Yeah, the life breath of a bus is roughly 10 years. So, there's all kinds of stuff that we use, from the factory. They're sprayed underneath for rust and protection. And it's like that everywhere you go. There's no washing of vehicles for commercial stuff. And any resident can just do it. But obviously, commercial side of it, we have the regulations. And, we follow those to a T.
Because they looked very clean when I was over there. I didn't go in a bus, I can assure you, but yeah.
They're very dusty right now.
No, they were clean. They did. At least on Sunday they did.
Yeah, most of them are brand new.
Okay, maybe that's why.
Yeah.
Okay.
So who else do you have to talk to about this? What other agencies or organizations or boards or?
So right now we're I believe it's just the health department for the hazardous materials license.
I'd like to hear from Carl.
Director Murphy.
Yes. What they're applying for tonight is their hazardous material license at this board, whether it should be granted and at what quantity level, whether it's 200 gallons, it could be 200 gallons, or 400, 800, or more. So I think that's one question.
Right.
I would recommend that they have submitted some paperwork to you about how the operation goes and the quantities and what they do, and you have a table of contents. So I think you might want to hear about their operation and probably discuss what quantities that the board is looking to give them. They are within the Aquifer Protection District to protect our town well fields. There is no requirement that they automatically get grandfathered into the preceding business, so I think it's up to them to make a presentation to the board, which we've told them of what chemical quantities that they're requesting and what the board would be issuing. And then I think you could hear from them, and Carl does have some follow-up notes from Field Notes.
Right.
But I think we probably need their presentation first to understand their operation and how much they're asking for.
Right. Yeah, and certainly would want to know the history of the connection between the health department and you, and since you first started this business, I guess. I just remember, we just found out about you. Yeah, if you give us some details and educate us a little bit about the products you want to be using. You have to understand, we're trying to balance two things here, and that is encouraging businesses here that we need against the risk of having this kind of business, essentially, the devastating effect it would have on our drinking water. And also financially, if there was some kind of hazardous material that gets into the ground, there would be a huge financial burden to this town as well. So that's the balance that where we are trying to decide what to do.
Okay. So we've been in business since 1989, been doing school buses my whole life. We mimicked the same setup kind of we've been doing everywhere. When we first purchased the facility, we did our due diligence on the background. We knew it was pre-existing, non-conforming, in that, based on all the other businesses in the area, it was something we had made sure we'd gone through, and that should be something that would be acceptable and that we would be able to move forward with that. So that was the first part of the process. Once we finally closed on the actual facility itself, was the first time we were told that we could speak to people from the town on, because we didn't even own the property until the end of June. So right at that point when we closed, we came down and we introduced ourselves to the building department, the health department, the fire department. We came down and hey, here's what we're doing. We're the new vendor in town, the new contractor. We were just awarded low bid. We're trying to get this set up. We just closed on this property. Kind of what do we need to do? We're looking for the guidance on that side of it, because every town operates a little bit differently. So at that point, we knew that we were going to be doing some site work. So we had an outside engineer, and we worked closely with our outside engineer with all the departments in the town. We went through 4 or 5 site plan reviews, and we made all kinds of changes and came to agreement with what we were going to be doing. And ultimately, that ended up taking 8 months. So March 22nd is when we finally got the signed off plans on that, and we had to wait the 20-day grace period, which was up, I don't know the exact date, but once that was occurred, we got everything we needed to do with the Registry of Deeds, and we were ready to start commencing the expansion, not the expansion project, but doing what we needed to do for the parking. And when we're working closely with Carl and Bruce, we were told that we needed to wait to talk about the hazmat license, what we're going to be doing, until we had our full site plan approval, even though we weren't changing anything to the building really at all. We weren't going to do any changes to that. It was just going to be automotive repair, just like Dr. Wheels has been doing since the mid to late 80s. And then, so once we got signed off, we reached out to Carl, hey, what do we need to do to move forward with this now? And we advised we needed to come in front of the board and talk about, our quantities for the hazardous materials license, for what we do in terms of repairing our own vehicles. We have just regular oil for the engines, and then we have a tank that we would change. We would take the waste oil when we do oil changes, and that would go into the waste oil tank, and everything is taken out by either Boston Green or Safety Clean, who we use both of those depending on our facilities. They pay us for the oil. They come and take that stuff away. We have windshield washer fluid to keep the windows, all clean from the washers. We would use a 55-gallon transmission fluid and a 55-gallon antifreeze. And the new age vehicles with all the emissions, everything gets treated downstream. So we have to use something called DEF, diesel exhaust fluid. So it's just urea basically, and it just mixes into the system and neutralizes all of the emissions. So that is in large quantities. Large meaning the big totes that we have are 330 gallons. That's going to be the largest one.
How is that put into the engine? What is that?
Yeah, so like you have like you would fill your car with gasoline or diesel. it would go in that same way. So you can either put it in with a 5-gallon jug, or the tote itself has a automatic pump on it that you would just pump it directly into it.
Just like a gasoline pump.
Yeah.
So what's the ratio from the fuel to this?
It's all computer generated, so it's either a 10 or a 15-gallon diesel exhaust fluid tank on the buses.
Yeah, I was just trying to learn in the sense of.
Yeah.
No, I don't know what the ratio is. The computer just says, hey, you're low on DEF. So then at that point you just fill it up.
Okay.
Did you say 55 gallons of transmission fluid? It
Yes.
says 5 gallons on your.
I'm sorry.
Yeah, I think it was a 5-gallon that we had changed it to.
Yeah, that's 55 gallons. Yes, that is a great catch. That's 5 gallons. I don't know how that
It's
got
5
missed.
gallons.
Yeah. So
We
the
had
transmission fluid is it's all a specialized 295 TES version. So we don't go through a lot of that at all. There's 7 years before you even have to change any of those fluids.
We had made a lot of changes in talking with Bruce and Carl, trying to get our quantities down as little as possible, to have the least amount of impact on that property, knowing that it's in that aquifer protection area. And to kind of piggyback onto that, when you look at what our business is going to be doing there, although we are asking for an increase in the actual volume on site, the turnover is going to be significantly less on our fleet. For one, the age of the vehicles being much newer, the amount of times that we change oil once a year, every 15,000 miles. Most of the vehicles end up just getting that once a year oil change. So, when you look at someone like Dr. Wheels with 400 customers, the turnover rate, how many times are they emptying that waste oil? How many times are they filling that virgin oil? As you increase in that volume, you're also increasing the risk. Every time a hand touches something, there's an increased risk of a spill. So, we're looking for the consideration that, yes, we are asking for an increase, but we're also, explaining that we're going to be using that material less. The highest turnover is basically going to be that DEF because it's going in with the fuel. But as it is considered a hazardous material, it is somewhat of a natural product. It's a urea. Just hopefully you can take that in consideration with our quantities.
Is this the same kind of emergency spill response plan you have for your other locations?
Yes.
Yes.
Is that something you've had to, have you ever had any incidents at your other locations?
No, we have not. But we also have on-site fueling plans that we follow. So with our DEF, it's our diesel exhaust fluid. It's the same exact as it would be diesel. We would only allow management, but we're not doing any on-site diesel fueling from our own tank at all. But I just wanted to explain, we have the same processes. So when the DEF goes in, the bucket goes underneath, it's on the solid surface, et cetera. We follow the same safety procedures.
Why don't we get a new voice here? Okay, Carl, maybe you can educate us, okay? It's a big deal here, obviously.
It is.
40 buses
It's
or
similar
end up
to.
being more.
I'm sorry?
We'll see, but it's.
Yeah, it's a similar, the repair operation that Five Star Bus proposes is a similar repair operation to what Dr. Wheels did. The big difference is the storage of the diesel exhaust fluid, because Dr. Wheels didn't maintain a fleet or have to, they didn't do a lot of diesel repair work. So they're going to need a little more quantities here in terms of total volume, but I think what's important is that they ask for a total quantity that will really work for them in the long term. And then if they need zoning relief because it's greater than what the previous site occupant had, then we'll, guide them through the Board of Appeals process. But I think it's important for them to have a total volume that they can work with. Because I've seen some businesses go in and kind of sell themselves short in terms of what they need in regard to total volume. And that can become a problem down the line, because if they overshoot that, then we kind of have to go back to the drawing board. So I'd like to see it done properly the first time.
At what point do they need to go for zoning relief?
If they're more than about 800 gallons, I looked through the Dr. Wheels files and, Dr. Wheels existed before the bylaw, Aquifer Protection Bylaw was enacted in 1989. So Dr. Wheels did not have a firm upper limit. So I went back and reconstructed as best I could by looking through past inspections and, you know, relying on memory. And I come up with about 800 gallons. I can't honestly say I ever saw more than that, so I'm trying to be as lenient as I can. So if they need it more than 800, it's been explained to me by the building department, who is our zoning department in town. It's been explained to me they'll need Board of Appeals relief. So if they ask for, you know, 1,000 or 1,200, they'll need zoning relief. And we've seen other businesses go that route, and we help them through the process.
And so you're asking for how much?
Well, I guess that comes down to what we're looking for. What we would need to service our business, Carl, it would never grow. That's kind of the standard we use at all of our facilities. So I would not see those quantities going up ever. And I'm very confident to say that. What we kind of had proposed here. So if we look at for our totals, I mean, do we really need to have 2 55-gallon drums of antifreeze when we're really only going to be having one? Just when the changeover comes in, like, do we need to really count that as a one, even though we're never going to be having 2 tanks? You know, so if we look at that stuff, I'm sure we can get down to somewhere around that number we need to be at. Worst case is, you know, if we need to be at that 800, you know, then we could get rid of the 250 or 275-gallon waste oil tank and just go to a 55-gallon drum and have it emptied more often.
Okay, so is 1,400 more than you think you need? I just want to make
Yes.
sure you ask for enough. Okay.
So if we look at, do the math here, Trev. We got 275.
That was the approximate total that I arrived at when I added up your submittal list. I just didn't want to see you ask for 800 if you feel it's not a workable amount.
So if we did our 275 virgin oil.
My back is making
We
obscene
did 275
gestures.
waste. We'd have 1 antifreeze at 55, 1 waste antifreeze at 55. The 5-gallon transmission, 30-gallon gear oil, 330-gallon def tote. And we get this washer fluid goes to 55. Yeah, that puts us at roughly 1,000.
The more you transfer,
Yeah,
the more dangerous
1,080.
it gets.
Yeah.
The more you move the shit around.
What was it?
1,080.
Trust me, I've been doing it for 55 years.
So I mean, like we said before, I think, you know, if we say 1,200, then we're well within it, but we're still over the 8.
Yeah. So just quickly doing some numbers, if we add up kind of what we would be proposing without having to double up on a secondary waste antifreeze and the secondary antifreeze 55-gallon drums, puts us roughly at, 1,080 gallons. So I know Carl said that, you know, in their review, they thought that they were roughly at 800 gallons. I don't know if the board has any documents of what they actually had for their license, Dr. Wheels. Maybe you guys could give some insight on that.
Paul's already spoken to
yeah.
that. They didn't have any limits.
Oh, 'cause they didn't have okay, I'm sorry, I didn't understand.
It's before
Yep.
the Aquifer Protection District.
Okay.
But from your reviews of the file, that's approximately what you put together was about the 800.
Right, and I itemized that as best I could on page 2 of the memo that the board received, and Darren and Trav, you received a copy of that too. So on page 2, at the top, that's the most accurate workup I could complete of the Dr. Wheels quantity.
No.
Yeah, I don't have that.
It's at the top of that page. And then I allowed a little over 100 gallons for the miscellaneous specialty fluids.
So Carl, you'd be looking for a permit for around 1,100 gallons? 1,000? Or
Yeah,
around 1,100?
based off the, you know, based off the numbers I just ran, we had, so a 275-gallon double-walled oil tank, we had a 275.
Okay.
So I could reduce the 275 waste oil tank to a 55-gallon waste oil tank. It would just, you know, we only change our,
The double wall tank for the waste oil would be a lot safer than a 55-gallon drum, okay?
agreed. But we'd also have it on the spill containment.
Yeah, so all of these are on the
Oh, I
100%.
understand that, but, you know, the double wall container's a lot safer than a drum.
Agreed.
So if you got the permit for like 1,100 gallons, you could eliminate the 55-gallon drum, correct?
Yes.
Okay, I'm comfortable with that. You know, how do you feel about it, Kyle?
It's up to the board. It's not up to me. So I just want to make sure they ask for what they feel they really need.
Yeah, I don't want to see them try and make a shortcut when you're moving this material around, and that's when you have the problem. If you have the proper storage and it's done the proper way, yeah, no problem.
I mean, there's also the issue, though, that it doesn't tell you how frequently these containers are filled. It's more, certainly it's safer to have larger ones in some ways as opposed to keep filling it. That doesn't put a ceiling on the amount of business that you'll be doing, or the amount of fueling and repairs are done. I guess I was a little concerned when I went over the property. You have room for another 40 buses with what you're leveling right now, the amount of space.
No, that's not true. We're already set up with employee parking, and then all of our bus parking is going to be into the backside, all fenced in. There's no growth for any buses out of that lot at all.
Enormous property. I'm very surprised to hear that. Okay.
And on the site plan that we had the review on, it states the number of
Be no
spots for the
buses out
parking.
front, I already checked on that.
And right now, what
I
you
was talking on
see
the right side, actually, on the,
is an extremely congested parking lot where it's almost impossible to park in there. I mean, we have double parked. They're in there as tight as we can possibly get them. We're also putting in a bioretention pond in the back side of it, which hasn't started yet, so we're going to lose some parking back there. So, and then again, we're taking all of the on-street parking out and putting all of the employees in their own parking lot with the tree islands in the landscaped areas. So, I mean, yes, it does look enormous right now.
nice to see a lot. I mean, did you get a drawing on this? We didn't get anything. We have no idea.
I'm sorry, I didn't know we were supposed to share in this.
We were told that this is what we had to put together. That's what we did for this review.
For that,
I mean,
but
I have the plans in my truck if you want me to go get them. I can bring them in there and show you. I'd be more than happy to. We're very excited with the way it's going to look and it's going to come out.
Well, you're putting a big investment in this.
And there's, I mean, the way fuel costs this day and age, it doesn't even make sense to run buses for any other district out of there, nor would we want to. So we have, for the district, we have those 40 buses, and that's what we're running, and just enough parking for our employees.
Yeah, if there was any other district to come along, we need to find a building and a site that's going to be close, because like Darren mentioned, you know, the hourly cost for the employees and then the fuel cost for the buses, it makes the most sense to be as close as you possibly can, which is why the spot was picked. The proximity to all the schools and, you know, proximity in the district. It's very centrally located, easy access to highway, easy access to all these main roads.
Great for that.
Which helped us come in at a lower bid than the previous guy.
Right.
What is the bioretention pond?
It's for the storm runoff. Upon the site plan review, you know, they requested that it be paved. So it's basically the runoff from the parking lot will catch any of the silt or not allow that to leach into other properties.
So if you're asking 1,100 gallons, then that has to go for zoning review.
That's my understanding, yes. We don't have a zoning officer here tonight, but that's my understanding. Any increase, whether it's to 1,100, 1,200, or 15, needs zoning relief.
Does that 1,100, let's call it 1,200, include the two antifreeze 55-gallon drums? Because you do really need to have two, because if you have one that's almost empty, then you bring another one in, they do need to be in containment areas.
Yeah, no, understood. No, I removed that because, I mean, we don't keep them at other facilities. I wouldn't see us keeping them here either.
All right, so if we just round it to make it easier, 1,200 gallons is what you're looking for.
Yeah, 1,200 would cover that.
Then that would be the board's question. Would you want to increase it from 800 to 1,200? Or even up to 800, that's the question. And then should you go board move forward, anything over 800, they would have to go to the Board of Appeals to ask for that relief. And then the board would have to give a recommendation either tonight or at a later date, they would have to reappear.
Right. Okay.
Carl, have you been in the building recently?
Not recently.
So we don't know the condition, the floor, or the business there? Or?
Not right now. I mean, the last time I was there, the condition was fine, but I haven't been recently.
Yeah, nothing has changed.
If we take
There is you probably noticed there is a condition, recommendation from the department on regarding the outdoor rusty heating tank that's there. There's no date on that. That if it goes forward for approval, that we'd probably want that rusty tank replaced with a double wall tank for the heating. Do you want to explain how that tank is used?
Yeah, it's the heating tank for the building. It was outside. It was just the setup. I believe it was single wall, 275-gallon oil tank, all rusted out. But we've already been in contact with our oil supplier to replace that. They're actually going to be swapping that because a part of the site plan, I believe that we had agreed that a part of the site plan review was that to be replaced. So
That
that's
double wall tank you're replacing it with?
yes, and it's going to be inside as well, not outside to the elements.
The five-star bus technicians, these aren't the drivers.
No, we have one on-site maintenance guy.
What was that? What did you ask?
The five-star bus technicians.
Right.
And who are they? I mean, they're not the drivers.
Right.
Yeah, the mechanics.
Right.
But there's one on site at this particular location.
So one does all the work?
Yes.
The 40 buses?
Yes.
Yeah, they're all new.
Yep.
You don't expect a lot of problems, right?
We knock on wood for that as well.
So again, I know that we could remove that 275-gallon waste oil tank and go to a 55-gallon, and that gets us roughly between 800 and 900 gallons. I just don't know how long the ZBA board would take to get heard and discussed, and we're coming along lines now of approaching those 15,000 miles once a year. Obviously, our warranties get voided. Yeah, we could get them over to Hyannis. But obviously, there's additional costs to do that as well. So we just ask you to take that into advisement as well. We'll do whatever we need to do.
So what was it you were taking off to get to the 800 or 900, did you say?
So what I was doing is I was reducing the 275-gallon waste oil tank and going to go to a 55-gallon, because in the volumes and the quantities and how we do it, that 275-gallon would never be full.
How frequently would you need to empty a 55-gallon?
So the way we do is we cycle every 15,000 miles, or at a minimum once a year we change our oil.
How many times, he's asking about the 55-gallon
So-
drum. How often
Oh.
would you have to empty the 55-gallon drum?
I mean, with the quantities, I would say maybe 3 times a year.
Okay.
As opposed to once every other year or so? with the-
It would be changed out probably once a year minimum.
Yeah, they would probably
For the
just
200.
Yeah, just as they were coming over, they would probably just empty that.
What does the board want to do this evening on this? Can make a decision tonight, can postpone it and talk about it another time. So how do you want to move forward on this? I think we need to make some decision on the issue, that's all. Only that we have another proposal coming up here in the meeting, a complicated one, so.
I don't see why we can't give them a 1,200-gallon storage.
What did you say, John?
That'll fit the business, and it'll also make things a lot smoother, because we get the double wall tank. I'm not comfortable with 55-gallon drums. You know, but a double wall tank can take a hell of a beating before they leak.
And they don't make them smaller than 275 gallons?
Beg pardon?
They don't make them smaller than 275?
I mean, we could possibly get like a
Not
250,
worthwhile.
but that's the bulk, the standard bulk size.
Yeah, it's not worthwhile. You know, the double wall tank is the best way to fly. I've got 3 of them.
Agreed.
You know, it's the
Totally agree.
best way to go.
Agreed, yep.
What happens if there's another business, so it's you own the property, you don't get the contract, and someone else? How does that affect what our authority we have with the next business that comes in to use this site?
In terms of quantities stored?
For whatever regulations. Let's say we're thrilled with what happens, or we're really upset that it's, you know, issues have not been addressed, there are violations or whatever. What would happen next? in a sense?
Okay, well, if it's a new business coming in, then the first step is they would meet with the building department to get a zoning determination on the new proposal. Then regarding the hazardous materials, they would come back to the Board of Health again, and the Board of Health would have the opportunity, like you have tonight, to set a limit for a new business.
Right.
Well, it isn't like we're setting a precedence for every business in town. We're setting a precedence for just this one.
Yes.
Yep.
Correct. Okay. So, I got no problem with that at all.
Are you making a motion?
I'll make a motion
Okay.
to grant, let's see if I could do this the right way, to grant Five Star Bus Company at 9 Commonwealth Avenue in South Yarmouth, the 1,200-gallon storage for be the maximum quantity for all where's that list?
Yeah, I apologize, we didn't number the
No,
pages.
that's fine. You don't have,
Toxic.
you don't have to break it down. You can just say 1,200.
For the 1,200-gallon
Yeah,
storage
period.
for the oil, waste oil, antifreeze, whatever they're
Hazardous,
gonna need for
yeah,
the,
hazardous materials is fine.
for all the hazardous materials they have, yeah.
Do you feel comfortable including the 5 recommendations that Carl made to your motion?
Maximum storage has usually to be determined by the board. Yeah.
Okay, why don't you just read those for the record?
Also, maximum on-site storage of toxic or hazardous materials is to be determined by the Board of Health. Detailed materials bill containment plan, which is already in here, I believe. That rusty tank to be removed, and it's already going to take care of that.
It's already
Yes, it's
happening
already
right now.
Vehicle repair conducted inside building, and no vehicle washes.
Yes.
And you feel comfortable also adding that the building is inspected by the health department, that we
Yeah.
look at the building if we know the status?
Yeah, well,
You guys are welcome to come down anytime.
I've seen the building, I've been in it many times.
Okay. Well, I'm just more concerned about the health department be inside before this goes forward, that's all. Is that okay? And adding,
Sure.
it's your motion, I'm just kind of feeding things to you, but, yeah?
If you written down, let down.
I got you.
Okay.
Okay, yeah.
Right, okay. Is there a second to that motion?
Second.
All right. Any discussion here? I mean, there's been a lot. Anybody have conflicts? Now's the time to start talking about it. No? Okay, so all in favor of the motion, raise your hand, please, and say aye.
Aye.
It's unanimous.
Right, just for time ways,
Yeah.
because it's more than the 800, you will have to file with the Board of Appeals.
Okay.
So before you bring in any chemicals at all, you need to go to the Board of Appeals first, so you still have to
Okay.
not do anything there.
Understood.
And then I will just take this consensus from the board that that's a favorable response to the Board of Appeals for
Yes.
the 1,200.
Right,
Correct.
Okay, good.
with all of the conditions that Carl
Okay,
has.
very good.
Thank you for your time on this, Cal.
You're welcome, my pleasure. Thank you.
Good job as usual, Carl. Okay.
Thank you to the board, and if anybody has any questions, we're always available.
Absolutely.
You guys are welcome to come down anytime and take a look.
Cool.
Thank
Okay.
you.
Thank you very much.
Good luck
Appreciate your
in
time.
business, okay?
Thank you.
Welcome to town.
Yeah, we're excited to be part of the community.
Thank you very much.
Thanks, Travis. save these? Thanks, Darren. Yeah, you can call me tomorrow if you want, and we can talk about timing and, okay.
5-minute recess.
All right, thank you.
Recess for
Good night.
5 minutes, everyone?
I gotta stand up.
My hot flash is turning into a hot 2 hour.
This is the 9th item on the agenda, okay? And it's for proposed New Seasons Corner Market Convenience Store / Shell Fuel Station, 473, 479, 487 Station Ave, South Yarmouth. Director Murphy, anything you want to say to kick this off, or not?
Yeah, I'll just say, we have the proposal, as you mentioned before us, for a new gas station, Shell fueling station. We do have, you'll hear as part of their presentation, the current Shell station, Sunoco station, that's there. They'll be closing, and their request is to move that fuel storage, reduce that fuel storage, and move it up to the new site, put a restriction on closing those 2 stations for gas fueling.
Okay.
You'll hear that. You also hear about the septic system. They need to have additional land that's needed, so they'll have to talk about the nitrogen aggregation plan. They need more land to come back, and they'll tell you about the land that they'll be purchasing, and they'll need to come back to the Board of probably Health on that at some point in time. And some of the handling and storage of hazardous materials, which is a lot smaller than what we've been hearing tonight, but it'll be inside the store, similar to what other stores that we've had that Kyle will be able to address. And then they'll also talk about their transfer of their tobacco sales. So that's the general overview. I think they have a well presentation for you. Kyle can do a follow-up afterwards.
I count 8 people, so, okay, welcome, everyone. So anyone who is going to speak, once again, introduce and print your name on that list, that's all.
Thank you. Yes, we've all signed in.
Good.
Thank you.
Welcome.
Thank you.
You're on.
Good evening. For the record, my name is Andrew Singer. I'm an attorney from Dennis, here on behalf of the applicant. With me at the table is Eric Simpson, who is the hazardous materials specialist for the applicant, Colbia Enterprises. Also with us is Andrew Delicarpini, who is the president of Colbia. It's a family-owned business, and several other representatives of Colbia. On the technical staff, Al McCallie, who is the project engineer, is behind me, as is Danny Gonzalez, who is from Down Cape Engineering, who is doing the septic system. I got most everybody. We may all be speaking or not. To start off, what we were going to do is I was going to give I want to outline the proposal and the process we're doing, because this is a complex project with a lot of moving parts. Eric is going to go over the hazardous materials aspects in detail. Also, we have already completed independent peer review, and that peer review has been reviewed by DPW, Board of Health staff, and the town's outside water consultant, and you have reports from both those. So Brian Moore, who is from Carriage House Consulting, who is the peer reviewer, is here as well. And he, after Eric speaks, he's happy to speak with you as well. We're all here happy to answer any questions. I'd like to start off before I go into the overall project and where we are in the process. Thank Bruce and Carl we've met with them a number of times. As you saw in the memorandum that we submitted, the last 5 pages or so were responses to questions that we've been working on with Carl and revisions to the plan. So that's been a very good process as we've undergone it. We have completed site plan review, and so we are here and we've applied to the Board of Appeals. We are going to the Board of Appeals on May 8th. One of the things, and this was alluded to in your last hearing, when you go to the Board of Appeals, they ask for comments in the APD from the Board of Health. So we're here for several reasons tonight, as Bruce alluded to, but we're only here asking you for one action tonight. The action we're asking you for is to provide comments to the Board of Appeals. The other things we're going to talk about, from the nitrogen aggregation plan to tobacco to the deed restrictions to all of that, are things that are going to happen later. They will be conditions of any comments, I assume, that you make. They're going to be conditions of the Board of Appeals application. And we'll be coming back to you twice, at least. Once going to be when we ultimately apply for the nitrogen aggregation plan, and I'll discuss that a little bit. And once when we come back to seek to transfer the retail tobacco permit from across the street to the new site. So those will be separate applications. So again, what we're asking you for tonight are comments to the Board of Appeals. As to the proposal itself, we're very excited about this proposal. This is, I've been doing this for a long time, and this is one of those projects where we're actually looking at beyond just the property we're on. You know, zoning and health, you're usually looking at one site. This is a project that's able to look at the aquifer, or at least a piece of it. And so just wanted to, that is the site plan, but to just give you and whoever's watching, this is the new site. So this is the rail trail. This is CVS right here, and this is Wendy's. So this is the new property, and on Station Avenue, this is the existing Shell station, and this is the existing Sunoco station, which you're obviously very familiar with. As Bruce mentioned, the proposal, and we're looking at this again, as I said, as a area-wide kind of proposal, and it requires a lot of relief from the zoning board. So that's one of the things we'll be doing with them. You guys are critical, obviously. And so the proposal right now, at the Shell station and at the Sunoco station, you have a total of 7 underground fuel tanks, a mix of single and double wall tanks that are anywhere from 20 to 40 years old or so. They're old. And there are 6 dispensers, and these 2 gas stations contain a total storage of 56,000 gallons of fuel. So what we're proposing to do on just the straight gas level is to remove those 7 dispensers, those 6 dispensers in the 56,000 gallons, and replace them with still 6 dispensers, but only 40,000 gallons of fuel in new double-wall underground tanks, which Eric will go through all the details of them and the monitoring and everything with that. So there's going to be and this whole area is in the APD. And so in the APD in general, in this specific area, what we're going to have is a very significant drop in the amount of fuel that's stored in the aquifer, and a very significant increase in the protection, monitoring, and status of that fuel that's there. And so one of the things we see as a very big plus on this project is not only a significant improvement to the aquifer, but a significant reduction in risk to the aquifer with all of the new equipment that will replace the old equipment. In addition, the 2 sites, the Shell site has 2 additional underground tanks. There is a waste oil tank and a heating oil tank, and Sunoco has a below ground waste oil tank, and the heating oil tank is above ground. What we're proposing to do is to remove those additional 3 underground tanks, and they would be replaced with above ground tanks at each site. So for the waste oil that they're required to use for the car maintenance and for the heating, those would be above ground tanks. So there would be a removal of 10 underground tanks at these 2 properties, and none would be replaced. And so there would be, the only underground tanks would now be at the new site. These sites would have only above-ground tanks for the heating and the waste oil, and they would have no future fuel service. And one of the, or two of the documents that I submitted to you are proposed deed restrictions, one for each property that would be entered into and recorded. Now, this property, the Shell station, is owned by my client, Colbia Enterprises, is the owner of that, and they've agreed to deed restrict that property. And the owner of this property, we have reached an agreement with him as well, where he has agreed to the decommissioning and to deed restricting his property. So you have draft deed restrictions that I prepared, one for each property. So that's another improvement of the project, is that future redevelopment of these sites, and someday I'm sure they will be redeveloped, they would have to be a use that did not contain fuel. And if they had any, they have some hazardous materials now with the car repair at each property, they'd have to come back to you, at that point for whatever permits might be needed. There is also, as part of the proposal that Eric will discuss, in addition to the reduction in the fuel, there's also going to be a reduction of 45 to 50 linear feet of underground piping, because you need less piping for the one site than you have for the two existing sites. And that will be replaced with, again, newer, higher standard piping than you have now. Eric will also discuss, there is, and I can read this, and it sounds like you'll understand it, and he'll be able to tell it to you. The double wall tank system with the leak detection using brine in the interstitial space. They're going to have those in the new ones for monitoring and protection. And from an environmental point of view, those are the real big overview proposals to improve this whole section of the aquifer. And what we gave you, as I mentioned, in addition to, there's a whole environmental memorandum. I know you probably got more stuff than you wanted from us. You do have the report from the peer reviewer. You also have Carl's report, and he prepared a very detailed and lengthy report going through not only what we've proposed and what I've been saying to you in his review of it, also the several conditions. 4 of the conditions were proposed by the town's water consultant, which we're fine with, and there were several other conditions that Carl proposed that we think make a lot of sense for this project. So from the comment to the Board of Appeals that we're asking for, these are the improvements, the environmental improvements that we're proposing. Now, on the septic system, the septic system itself will be conforming for the site, but there is not enough land area given in the aquifer because of the ratios that you need. The site's going to have the the Seasons Corner Market convenience store. There will be a co-brand business, as is pretty typical in convenience stores, and you'll have the gas station itself. There is a drive-through proposed, but there is no car wash at this facility. In order to meet the requirements of the APD for the nitrogen reduction, what we are proposing is a nitrogen aggregation plan, which this would be, our site would be the facility land portion of the restriction, and we would deed restrict off-site open space as the credit land restriction. And that, as you know, will require, that's why I mentioned, we're not asking you for that tonight. We're here discussing it, happy to answer questions, but we'll actually have to apply for that. We'll give you the draft documents, and there'll have to be a hearing where you go through that and review that. Now, as far as what would be the open space, where's this off-site land coming from? We have been working with the accounting and town administrator's offices on attempting to utilize the town's new land disposition policy. It's a brand new policy. It's actually being, the charge for it and the committee for it are being reviewed in this room tomorrow night by the Board of Selectmen. So this is brand new, and what that is a new policy that was adopted by the town to attempt to monetize some of the town-owned land that is just sitting. Some town-owned land has been purchased, some has been given to it. Much of it is foreclosed land that the town has taken over the years. What we're looking at through the land disposition policy is some of the foreclosed land, and that's what we've been working at closely with, as I said, the finance department and the administrator's office. We have identified several parcels of town-owned land that are owned through foreclosure that might be suitable. They're not definitive yet. That's up to the town and the whole committee. But what the process would be with the town is that these lots that are owned by the town by way of foreclosure can be dispensed with at public auction. They don't require a town meeting vote, whereas other town-owned land that you purchase requires a town meeting vote. So what we have applied to the town administrator for, or to the selectmen through this process, is requesting that the town consider putting up for public auction a number of different parcels of land that meet the requirements of the nitrogen aggregation proposal, which is they have to be in the same APD, they have to be open space, they have to be able to be deed restricted. And there are a number of them that are possibilities. What will happen with that, and this is why we can't tell you exactly where they would be, other than to agree that any comments from you and any approval from the Board of Appeals will have to have an express condition that a nitrogen aggregation plan be entered into before the project can move forward, because without it, we can't satisfy all the rules. This project has many, many moving parts. You guys are one big cog of it, but there are a whole bunch of them in other departments. What we hope tomorrow night, if the selectmen approve the charge for the committee and appoint the committee, is that, my understanding is that our applications, and we filed 3 of them, would be submitted to this new committee to review and to begin that process. So once that process is done, we'll work through that process. The end result of that process will hopefully be 1 or more public auctions, which my client will hopefully be the successful bidder at 1 or more of them, as necessary. We only need 1, but there would be more than 1, potentially more than 1 auction. And then when that has been delineated or determined, then we come back to you. That's when you'd get an application from us, formal application for completing the nitrogen aggregation plan. Needless to say, that another step in this process is, at the end of the day, we also have to go to the selectmen for fuel storage permit. We'd be decommissioning the ones at the 2 existing sites and requesting a new one at this site. So that's also part of the process. Finally, before we jump back to Eric and the hazardous materials discussion, the technical stuff, tobacco. You have the new policy on, the moratorium on new tobacco sales permits, but you do allow, through the process, an applicant to seek to transfer. The existing Shell station has such a license, same owner. What we would be doing is applying, again, as we get further down the road, to you, which is probably a new process for you as well, seeking to transfer that tobacco sales permit from the existing Shell to the new site. So again, we will be back before you a couple times. If you, after Eric speaks and you hear from the peer reviewer and Carl, if you have questions for any of us, whether it's septic, engineering, hazardous materials, we can go through. One of the things I guess we didn't, well, Eric will go through this. He'll discuss the site plan more. I really didn't get into that, but he can discuss where everything would be on the site and how it will interact with the other sites as well. Oh.
Sure. I'm Eric Simpson. I'm the environmental director for Colbia. I'm a professional geologist and an LSP, so you know what I do. Basically, what Mr. Singer presented earlier does a very good job summing up. This is a unique project in that you don't usually have the opportunity to decommission 2 existing facilities in an aquifer protection district, build a new one with an aggregate reduction in total fuel storage, and improve the infrastructure all at the same time, plus get a deed restriction on the 2 former properties so that they don't get used again in the future. So from an aquifer perspective, this is a significant improvement in what's in the ground. The Shell station, as it stands, has 3 single-wall tanks installed in 1970. Not to date myself, but that's 3 years older than I am. So those are old tanks. Be careful.
I remember when they went in.
Yeah. The state of Massachusetts allows single-wall fiberglass tanks. They're not. There's no statute requiring them to be removed. The Sunoco has double-wall tanks from '86. I do remember that. Ghostbusters came out in '84. So, but this is the infrastructure that we'd be looking to remove from these 2 properties. What we normally install in our new season stores are a pair of 20,000-gallon tanks that are brand new. They're double-wall fiberglass tanks. We use a brine saltwater interstitial liquid with full electronic monitoring. That gives us complete electronic notification if there's any change going on with the tank. So if there was a problem with the inner wall or the outer wall, either way we would see something change in the brine level. That allows us to respond immediately if there was an issue. It's basically the state of the art as what's produced right now. In terms of the actual orientation, typically we put the tanks quite close to the dispensers. You can probably try to use this. You can see the tanks are right there on the proposed plan. The dispensers are immediately next door to them. And what we do is we use a double wall seamless polyethylene piping that goes from the tanks to the dispensers. It's a single loop. It doesn't have any joints at all. It doesn't have any welds or seams. It's a single flexible, semi-flexible run. That is fuse welded into a double wall containment sump at both underneath each dispenser and also at the top of the tank where it goes in and connects to the submersible turbine. Each of those components are all electronically monitored. This monitoring system there's 2 different models that are used typically now, and they have full web interface. They email me constantly. I got an email that one of the printers went down at one of our facilities a few moments ago, so I have to fix a printer in the morning. So I get the emails all the time. They also get copied to our compliance consultant who handles our tank testing and whatnot, and also our maintenance department. So there's a triple redundancy in notifications. This is sort of a technology that doesn't exist at the existing 2 facilities. So this proposal is pretty unique in that not only are we reducing or proposing to reduce the amount of storage in the aquifer, we're also significantly upgrading the safety perspective. And as Mr. Singer said, this is really a risk reduction proposal. It's very unique in that typically you only get to look at one facility. You don't have the option of decommissioning someone else's gas station. That's highly unusual. In the absence of this project, the 2 gas stations are there right now. I drove by them today. So this is a significant improvement on what we're doing. In addition, there's some minor, or not minor, but some smaller items in terms of the 2 the heating oil tanks and waste oil tanks that would be coming out of the ground at both facilities. That's obviously an improvement when you replace those with above-ground tanks, double-walled above-ground tanks. In short, this is from an environmental perspective in terms of where is there risk and what could affect the aquifer. This is a pretty exciting project from my perspective in that you don't usually see this. So that's kind of the nutshell on the petroleum storage. Obviously, when the tanks come out of the ground on both the Shell station and the Sunoco station, under DEP regulations, the soil is tested, it's observed, the fire department is there. Obviously, there's reports that come to the Board of Health and the fire department in terms of those tank removals and what the soil conditions are following that. So that's all done per state regulation. And the new system would go in, and it is subject to all of the state regulations in terms of tank systems, in terms of monitoring. There's weekly inspections, monthly inspections, yearly inspections, 3-year inspections. That's referenced in Carl's memo. All of those are performed routinely. And then we have the full automatic alarm system and notification system that keeps, that's why I sleep with my phone. So that's sort of it in a nutshell in terms of what we're looking to do and what we're proposing to the Board of Health to get your opinion on. We feel that this is just a really unique opportunity to improve the quality or lower the risk in that particular area of the aquifer. On the second sort of item that we have is there's a very small amount of hazardous materials that are stored on the property for retail sales. Typically, our stores have 7 or 8 shelving units inside that we sell retail, whatever from Slim Jims to antifreeze or whatnot. Usually, we only have one of those one side of I guess, the 8 shelves, so that's one of 16 that has hazardous material. So it's a very small quantity. I think the number in here is under 200 gallons. And that's just motor oil and antifreeze and windshield washer fluid that we sell to the public. It's not used, it's not consumed, there's no auto repair. Consumers don't come in and work. It's not an auto zone where they come in and get some tools and work on their cars or anything. And that's kind of the hazmat in a nutshell that I wanted to present to you all. I didn't know if you had any questions.
And if I could just maybe add 2 points on that I had neglected to mention as well. With the hazardous materials inside, and you see those comments from Carl in his memo, there are some floor drains in the building, but where the hazardous materials will be isolated from where those are, and we could discuss that more, but that was something that, excuse me, was asked. Also, when you sell motor oil, you have to, by law, take it back if somebody wants to bring it in. So while this almost never happens with Seasons Corner Markets, there is a proposal to have a small container for that, either outside on a containment tray in the dumpster, in the fenced dumpster area, or inside the building. We put in, it's a very small quantity, but that's something that's also part of the application. And you do have comments. The fire department through site plan review, had looked at this, and they had no concerns with the overall proposal that we're presenting to you for comment. So those are just the additional things I wanted to mention. We're happy to answer questions now, or if you wanted to hear from the peer reviewer, I leave that up to you, Mr. Chairman and the board.
Does anyone have any questions right now? If not, excuse me, I'd ask Carl to come up and maybe speak to us. Anyone before Carl comes up? Nope. Okay. Would you help us out here a little bit? Your report is great as usual.
Thank you.
Really very helpful when you write these up.
So I feel it's a very straightforward proposal in that there's very little use of hazardous materials on the property. There's no auto repair, there's no automobile washing associated with this proposal. So it's strictly retail sales of small amounts of hazardous materials, such as the windshield wash that Eric mentioned, and motor oil, and then just the fuel dispensing by customers to vehicles. And again, it's a unique proposal where we're seeing new development, yet we're seeing removal of old development, meaning the old tanks, the old piping, that's going to more than offset the new storage volume. So it's very straightforward, and I think it's a reduction in risk to the aquifer in terms of the amount of material stored.
It's important to keep in mind, we keep using the word storage quantity. The other issue, of course, is how much fuel there is. And I would expect there will be more fuel on the ground overall than just refilling smaller tanks. I mean, business should do well there. You're replacing 2 other gas stations, and you're probably building a very nice, contemporary, clean, new fueling station compared to the 2 there that aren't particularly attractive and not that accessible in some ways. The parking there is getting in and out are tough. So, yeah, the upgraded equipment is great, but there's something else besides just storage quantity that needs to be kept in mind, I think. I would expect your business plan would be such that you'd expect to be selling more fuel than those 2 stations do now together.
Probably, without turning back to the president, I'm assuming that that's part of their business plan. You know.
I would think so. If not, we should be concerned. With what you're putting into it.
You do bring up a good point as far as, I guess, levels inside of tanks.
Identify yourself.
Oh, I'm Andrew Delacapini. I'm the CEO and one of the owners of Colbia Enterprises. It's a pleasure speaking in front of you guys tonight. We monitor, the delivery company monitors the tanks. We have a system at the location, and they basically determine when the tanks are almost empty that they deliver. The idea of storing fuel at the facility for us doesn't make any sense because it's just keeping cash tied up underground. So we don't try to keep the tanks topped off. There is certain times when we do fill them up. If we know there's a storm coming or something like that, we basically pull the fills on all our facilities and say run the trucks as fast as you can and as hard as you can for the first 2 or 3 days before that storm, because we know the difficulty of getting product to there once the storm does hit. But normally we run as low to capacity as possible at these locations. When the trucks do deliver, they normally deliver between 11 and 12,000 gallons at a time. Okay. So that gives you an idea of just where the tanks are. There is I'd almost question with 7 tanks, there's a certain amount of keep fill that they're going to have on 7 tanks. I really don't see that the volume is going to be increased that's in the actual ground, although the capacity itself will decrease. So.
I'm not sure I follow that 100%. So you disagree with what I said? I mean, I would think you're going to be selling more fuel than is sold on those 2 stations now.
Yes, I do agree that we will be selling more fuel, but that doesn't necessarily mean it's going to be in the ground. It's going to be going continuously through the car. So rather than, you might have 3,000 gallons, let's say we have 10,000 gallons sitting on the ground at a location. If it's a slower location, it's going to sit there for a longer period of time, where we might have 10,000 gallons, we'll sell more, and that truck has to make another delivery more often, so.
Okay.
That's also one of the benefits of this is since they do own the existing shell, they did look at, could you redevelop that site? And it just doesn't, you can tell from looking at the size, on the plan, it just doesn't work. So while those 2 stations can remain, and yes, they might not have as much volume, but they also don't have the protections and the, So when you look at the net, we think it's a very significant net benefit, but hopefully they will be more active.
My father-in-law started this business 60-plus years ago and turned it over to the kids, and we've run with it. I've been doing this for 27 years now. It's just a drop in the bucket, but I've seen a lot of different developments. We came up with the Seasons brand. It's our own personal brand. The other nice thing about this facility is, we're going to run the facility. It's my family that's going to be running it. It'll be my employees that'll be running it. Nobody else gets that Seasons brand other than ourselves. We were very fortunate to just build down the street, down in South Dennis. It opened up probably about a year and a half ago. So if you guys have been through there, you'll see exactly what we're really proposing to do. I really think it made a great improvement to what was there. And I do agree with you. The 2 sites that are on Station Ave right now are nothing that anybody's going to be writing home about or taking pictures of postcards about. So hopefully this one will improve the area. It'll improve the amenities that we can offer to our customers. And we want to be great partners in the town.
You were talking about protection. I was reading last night about Containment Solutions, the company, and they describe their triple-wall tanks to be used in environmentally sensitive areas, this is exactly what that is. This is our drinking water. And what you decided to use double, what's the issue? Which came up with some question here.
Yeah, we did respond to
literature. That it was mentioned.
Yeah, Eric had responded to that, so we can
it may not be a requirement of the state, but that doesn't mean what our requirements are necessarily. That's all. It was the language that came right out of their website. That's where I found it.
Typically, the triple wall tanks, when they talk about environmentally sensitive areas, they're talking about aquifer protection areas in earthquake activity zones, where they're worried about not only, they're worried about the ground moving, where you might lose the outer wall, and then you still have effectively a double wall tank. Thankfully, we don't live in California. So it's not something that's ever really done in Massachusetts. I was trying to find, after that comment came out, I was trying to find any evidence of a triple wall tank being installed, and I hadn't seen one. I haven't found one in Mass yet. Typically, because of all of the interstitial monitoring with the outer wall, the inner wall, the sumps and everything, if there's any issue with the tank, we're going to know immediately. And our response is typical if there's ever an issue, or even a lot of times there's not an issue, there's a question, a faulty sensor or something. Our first step is to empty the contents of that tank immediately, and then investigate what it is. And if there's an issue, almost always it's a faulty sensor. But we take the action right away. It comes to me. I get on the phone, even if it's in the middle of the night, with our maintenance folks. Our delivery and our tanker truck guys can pull the product out, and we'll be investigating the next day. We had a situation like that in Randolph not that long ago. We took care of it, and it wasn't really an issue. So we've never installed a triple wall tank. It seems, given the amount of electronic monitoring, it seems sort of overkill. I know containment implies for them to really be in a situation where there's an earthquake and there's something really catastrophic, and they want that extra level of protection. So that's, I guess, the best answer I have on that.
What's the price difference?
I don't know.
Typical tank? Okay.
Well, I don't know.
I mean, it's
probably substantial, but I don't know.
It's just typically not done.
like it so far. The 2 existing stations after the tanks are pulled out are still gonna be used for vehicle repair?
For now, yes.
Okay.
We don't know what, we can't
Yeah, I
speak to the other,
understand,
but
yeah.
yeah, at some point, I assume no in the future,
Yeah.
but for now, yes.
Yeah, no. That cuts down the amount of fuel on site, period, and also eliminates all the old stuff, which is,
How many pumps will you have? How
There-
many pumps?
There will be 6 dispensers, yes. So that's staying 6 for 6. But in the more modern configuration, though. Yeah, and as Eric said, or Andy said, if you've been to South Dennis, minus the car wash that's in South Dennis, you've seen the project.
Yeah.
At what point in this process would we be making decisions on the language in the deed restrictions? When would that take place? The actual language of it, of how we would want it restricted?
Probably the next time they come back to the board to discuss the deed restrictions for the tanks, I would think. Would not be tonight.
No, we could do that at the same time that we do the nitrogen aggregation plan. I would expect that your comments to the Board of Appeals will say that there will be deed restrictions to be mutually, agreed upon. And then, yes, you have the drafts and we can work with, you guys and/or council, depending on what you want to look at.
And if there is just one last comment I could make, I'll just stand up. I'm sure it's fine.
Just be near the mic, otherwise you just won't get picked up.
I'm sorry.
The people listening at home.
What we've seen is, as we've removed tanks, we've built about 34 seasons throughout Rhode Island and Massachusetts, and like I said, I've been doing this for years. It seems like the care and diligence that was used way back when these tanks were being put in really wasn't as sensitive as it should have been. And I think what it really the cause was, you had Big Oil, who was hiring contractors to just go in and put stuff in the ground, and contractors were sometimes using large stones, non-suitable soil, non-suitable material around these tanks, and we've had issues in the past where, when we're pulling these tanks out, you'll notice that there's a large stone on it just wearing away at the top of those tanks. That's something different. We hire our contractors. My construction manager, Eric, they're at that job watching those tanks go in. They're making sure pea stone is around it. They're making sure everything is done because they know we're going to be the ones operating. We're going to be the ones owning it.
Right.
The contractor's not just walking away. So it's not just what's in the ground, but also the way that it got put in and the way that it will be put in. So I just wanted to mention that. Thank you.
I think it's important to keep in mind that we're talking about having toxic substances in underground where our drinking water is coming from. And I'm not proposing we're not going to try to move ahead and get this business going and so on. But it's important to keep that in mind. The decision can be made, well, we shouldn't have any gasoline sitting underground where we get our drinking water from, to make sure that that decision is out there, can be made one way or another, and it shouldn't be ignored. That is an option, and I'm not proposing it, but it's a real one in this day and age. We want to have that there. Obviously, business-wise, it's a great thing to have. The fuel station up and running and looking as good as what I'm sure it's going to be. And when I was thinking, you probably weren't here yet. We had a couple of violations for tobacco. Okay, I don't know.
I'll get to more about.
I don't do tobacco.
Yeah, we heard some of those
And the
cases.
point I'm going to make, it's really in reference to the spill prevention and response plan. I know it's quite late, but I'm going to make a point about this. And that's a fairly simple thing overall. Sometimes people come in with a violation that they didn't ask the person how old they are before they sell the cigarettes to them. Pretty simple thing to do, you would think. Yet people come here with violations, suspensions. And I'm looking at the response plan, okay, that you've got here. And I just put a little circle next to the item here is what a person should do if there's a spill of fuel or chemicals here. It says responsibilities in the event of a gas spill, 5 gallons or more. So the question is who's going to be in the store there at the point when that were to occur? And I'm going to read it very quickly, and I'm sorry if I'm going to bore everyone. Basically, the person who's there is going to have to turn off power to the gas pump, Ensure all smoking materials are extinguished. Contain the spill as best as you can with spill containment cloths/speedy drying. If the spills extend beyond the crews, call one of the people listed below in the order that they appear. Follow the instructions. If they request, you can call the fire department. Use call procedures listed below. Calling procedures: call fire or police by 911. Tell them you are a Shell gas station and give the address, and you're supposed to do that. Tell the store number, store phone number. Tell them what the emergency you're reporting. Tell them what what kind of emergency occurred, and there's a long list of all the names and phone numbers. And then it goes on even longer than that. And the point I'm making is that's a lot to be able to have any person handle in the event of an emergency that way. And we have evidence here week after week where a person working in one of those stations isn't asking proof of ID that they're 21 or older to buy cigarettes. So once again, that's a complex thing for one person. It would be for me to follow
Sure.
directions in a stressful situation.
Normally what we'll do is, before anybody ever steps foot behind that cash register, we have training process. They go through a training period at our corporate office where they understand everything from where the fire suppression pole station is, what it actually causes, what a fire extinguisher is, how to use it. So we do have procedures in place to train them before they ever step behind the foot. On top of that, we have our own internal auditor who goes around and my son has done it. We basically take kids that are 16 and 17-year-old, and they drive around with them, and they go in and try to buy cigarettes. And if they can buy the cigarettes, we take that cashier. They go through an entire training process again to learn, hey, listen, you can't do this. You know what? This is what you have to look for, and so forth. If it's a second offense, they're terminated. So we do it internally ourselves to police ourselves. And my son did it when he was under 18. We've probably had dozens and dozens of kids that have gone out with this individual, and if he comes back with the pack, they go in, they give him the write-up and the procedure. So we do have a procedure in place because, to spend millions and millions of dollars to build a facility to lose a tobacco license is nothing that I really would ever consider doing. So we take it very seriously. We know that it's going to become more and more of a hot topic item, but we do as much as we can to be as proactive as we can to make sure that if cigarettes are getting in the hands of minors, they're not coming from our stores. So.
Yeah, I don't think I made the point clear enough. I'm not worried about that. I mean, it sounds great that you're all over that. I'm really talking about the 5 gallons of fuel that goes onto the ground. Of how complicated and stressful situation is for that person, what to do. That's the point I'm trying to make, and maybe I wasn't clear enough. That's the bigger issue for me. Training people to check IDs and so on is not that tough.
Right.
Okay, it's the issue of an emergency here with fuel and all the things that person's supposed to know how to do. That's asking a lot of any of us.
Sure it is.
Okay.
And to be honest with you, I think at any point a person is challenged, but we've had the situations happen in other locations, and our procedures have followed through. We've dispatched the right proper people, the environmental people. We've contained the problem, and everything has worked like clockwork. Can I guarantee it's going to always happen like that? I wish I could. But I guess the challenge I have is it's happening out there right now in an aquifer area at those 2 locations. Right. And by people I don't really have control over. So at least when we have the facility built, I know there's a certain protocol. I don't know how the employees were trained at the Sunoco station. I don't know what they have for spill prevention, but I know this is what we propose to do, and we've had the situation happen, and the process have worked seamlessly. So, I stand by this. So,
great.
Thank you.
Thank you.
Like
comments?
Yeah,
Anyone?
it would be nice to hear from the water person, consultant that looked at the aquifer protection.
That'd be great. Thank you for coming in. Have a seat.
No problem, thank you. My name is Brian Moore. I'm a Massachusetts LSP. I'm a professional geologist. I'm also a licensed UST third-party inspector. I basically share the same credentials that Eric shares. And I performed a peer review of the proposed project and submitted my findings in writing to the water department. And I'm here. A couple things that came up just in listening tonight that I was thinking about things on your behalf. They were talking about reduction in the total volume and the total number of tanks and the total number of widgets that go on those tanks. and having been doing this now for over 30, well, 20, whatever it is, a long time, I can tell you that those widgets are usually the problem items. I think Mr. Holloway understands this. It's the little things that get you. It's not the giant double wall tank that's going to be a problem. It's going to be the little elbow or the little screw that doesn't work like it should. And in a similar fashion, when you take two different properties that are run by two different companies that have two different training regimens and two different standards of care when it comes to hiring employees, and you reduce them to a single facility, you are also seeing a net benefit because spill response and management and maintenance are all going to be reduced as well. So there's less of an opportunity for someone to miss or to make a poor decision that would negatively impact your receptor, which is, of course, the APD in the town.
Right.
The only other comments I had to offer after, I was going to just mention that automobile maintenance is being, there's going to be no automobile maintenance at the new facility, which I think is a benefit to the town. And I'm sure, I haven't asked it, but I'm pretty sure that they'll be getting a certificate of compliance for your new UST system, which is an extra level of insurance that the town could rely on. It's a form of financial assurance that allows them to seek reimbursement or even go for direct payment of cleanup costs up to $1.5 million on a per occurrence basis with the Commonwealth. That's above and beyond the insurance they already carry. So it's like an umbrella over your umbrella. And that between the period of 1970 when those first tanks were put in and now, we've gone through 4 separate iterations of new UST regulations in the Commonwealth of Massachusetts, beginning in, I think, 1974, 86, about 98, and a couple years ago. Each successive regulatory improvement increased scrutiny and resolution as to how specific they could be with these little widgets and the little monitoring, and how you do inventory monitoring and how that's maintained and reported. And it is much more stringent. Everyone in this room can cop to it that it's much more stringent than it was in 1980 and 86. And some of these heritage systems have problems that go unknown for years, whereas like you're putting in a state-of-the-art system right now, which is designed, engineered, installed, monitored, all in accordance with the new regulations. So there's really no grandfathering going on, so to speak, which is a huge benefit to the APD and to the, to the town, because it will be more protective from my point of view of the APD. And I can answer any questions that you might have.
Well, one thing is the tanks do say they have a service life of 30 years.
That's the typical engineering license. That's a typical engineered life for underground storage tanks that are being manufactured today. In certain instances, other states and manufacturers offer extensions on those warranties out to 40 years, but those warranties are for defect in manufacturing practices, not about installation, not about monitoring. It's about the fiberglass coming apart in the tank or the steel coming apart. It's really, the installation has more to do with the integrity of those tank systems than any of the manufacturer stuff. Very rarely would you see someone go back after a manufacturer for a manufacturer
Would the
defect.
tanks be replaced after 30 years of their service life?
The tank
I don't know what
replacement,
you do in the other stores or what your rotation is?
Not necessarily. I mean, we have tanks out there, like, prime example, the tanks that are at this location, if they were put in 1970. So normally what ends up happening after 30 years.
You got to get up to the mic.
sorry.
Yeah, why don't you start over with your response?
I will.
Great, thank you.
Normally, what happens is after 30 years, we have environmental insurance, so the insurance starts to increase every year after that. So it's really a balancing act of where it makes sense to actually change out the tanks. The testing requirement becomes more stringent and so forth. So we do have tanks that are older than 30 years. We've been going through a process of replacing them, but there's no set policy in place that at the end of 30 years, they have to be pulled. Normally, what ends up happening is the towns, or I should say the states, change their requirements. Steel tanks have to be out of the ground. Single-wall tanks have to be out of the ground. And that usually is what facilitates updating the tanks that are underground throughout the entire states.
And right now, the federal government has no, for the particular tanks that they're talking about putting in, the federal government has no sunset provision for that design of tank, nor does the Commonwealth of Massachusetts.
Because they're so new?
Because as long as they test and meet the engineering requirements and specifications certified by the American Petroleum Institute and the Commonwealth of Massachusetts, the Commonwealth is satisfied that they are protective enough to continue to be used. So that's a standard that the legislature came up with.
So it's something we would need to think about, or if we're able to have any authority at this point. So if we're sitting here in 2080 and not had wished we had done something, that's all, if the same tanks are in the ground.
If you just look at what the improvements have done over the last 30 or 40 year with tanks, as
they will continue to happen. Yeah, these may be antiques in a few decades. That's the point I'm making, where that's something for us to keep in mind when we, act upon this. It's something to think about.
And usually DEP is, Department of Environmental Protection is usually the one that's at the forefront to make sure that if there is going to be any type of concern with the tanks or anything underground, they're the ones that are ratcheting up the, and usually see what happens in California and expect 5 to 7 years that's going to make its way to the East Coast. So that's normally the procedure. So I don't know if we could really have a crystal ball to say what will these tanks be. It might be double wall fiberglass might still be the norm by then.
Right.
So.
Okay, anyone else?
I have kind of an slightly off-topic
We
question.
could use it this hour.
Will there be access to the bike path, between the bike path and the new store?
When we had first started to develop this, I really wanted to get access to the bike path, but unfortunately, there's a railroad spike that goes across it, and it also has a fence. So unfortunately, there's no way to really cross that property. I think the railroad department?
Yeah,
Railroad still owns that or something?
we looked at it. Yeah, the railroad actually, when they extended the bike path, if you go out there, I actually walked it a week ago. So you physically can't do it because the bridge abutment goes past this property. But the railroad did not release their rights. You can actually see track that goes up to Station Avenue. It's all overgrown, hasn't been used in ages. But the trash train comes down to a certain point and turns around. But they didn't relinquish their ownership rights next to where the rail trail is. So that's between us and the path.
Yeah, that had been one of them, like when I first saw where the site was and with the bike path, I said, this would be perfect. We could have a little bike rack, a little place to sit down.
Right.
But unfortunately,
About
the
35
safety
feet.
issues. Yeah.
Yeah, because I abut it,
Oh, yeah.
down on Hoist Path.
Oh, okay, the other,
Yeah.
yep.
Yeah. Mark
And,
it off.
and
We actually
for us-
had it on an initial preliminary plan. We had some little seating out there, and then
Yeah.
when the engineer looked at it more closely, it was like, we can't.
Yeah, I'd love to be able to do it because I know how, like I said, we run our facilities and we hear all the time that our facilities look like parks. We don't skimp on landscaping, we don't skimp on the way the places look. And the challenge is going to be is obviously we can maintain our property, but that spike where the railroad has their rails coming down is always going to be there, and it's, we're not up against something that's probably going to be as well maintained as our property is going to be. So it'll be a little bit of a challenge, but hopefully
The
done.
kids on the bike path will find a way to get a soda.
I think on your landscaping also, it's going to be more of a challenge on this site because there's a note on, I think, the septic plan now about all landscape areas are going to be natural and no use of fertilization.
Mhm.
So you're going to have to be more probably organic.
Yeah, and they also asked for, particularly along that buffer, you can see it on the plan, they asked for a lot of the site plan review, what we're proposing. A lot of that right on the perimeter buffer, that the existing vegetation remain to the extent possible, some of the trees. So that's also going to be there. It's woods, and some of that woods will remain.
The larger stem trees.
The larger ones,
Right.
Anybody else? Something else? Have we answered your question or whatever you wanted from us?
Not quite yet. We appreciate the questions, but what we would ask for, what we're hoping you would do is to make a motion, take a vote on providing positive comments to the Board of Appeals, because they're going to be asking for it. they already have, so that Bruce can get back to them saying the Board of Health reviewed the proposal from the environmental point of view in the APD. We are seeking a variance to allow the fuel storage in the APD, because even though we're getting rid of it at the other two sites, it's new at this site. And so the Board of Appeals, under the zoning bylaw, section 400-something, or blanking on it right now. No, it's okay. I don't have my zoning bylaw with me. That section requires that they ask you for comments. And so that's, Mr. Chairman, what we'd ask is if the board's willing to do it, to make a positive recommendation, subject to the conditions that are set forth both in my memo and Carl's memo and your consultant's response to the peer review report, so that that would go to the Board of Appeals and they could put that into the record.
I make a motion that we recommend to the Board of Appeals that they favorably consider this project with the recommended conditions that are listed in Carl's memo. And it's on page 6, it goes on to page 7. And that there be some consideration to looking at the tanks at the 30-year point, or before, certainly, if necessary, but that not be just an infinite time out, but at 30 years.
That's pretty,
That's
that's
it?
good. I think so, to get things off. I mean, there'll be a lot of specifics, but we don't
Yeah.
need that right now.
No.
That's great. I think it's well stated. Thank you. Is there a second to that?
Second. Second.
Discussion? Probably not. All right.
Do we have to mention anything about the nitrate loading a septic at this time?
What I would, not about nitrate loading specifically, through the chair, what I would suggest is you might want to note in the comments that a formal nitrogen aggregation plan will need to be, so a condition is getting that approval from the Board of Health at the appropriate time. I would recommend that.
Right. No, point well taken. I mean, the whole thing could fall apart. You know, you guys have to figure this out. That's all, which I'm sure you will. But
So this is all predicated on an appropriate nitrogen aggregation plan.
Yeah.
Submitted to the Board of Health for review.
Yep.
Are you okay with it, Christine, with the motion? You are. I'm impressed. That's great. Okay. All in favor, say aye.
Aye.
It's unanimous. Fine. Okay.
Thank you very much.
Okay.
We appreciate your time.
Welcome.
Folks.
Thanks.
Move forward.
Appreciate it.
Great.
Oh, sorry.
Thank you.
My hot tub is waiting.
Almost time and a half. It's ready to be paid time and a half.
Okay, let's go to number 10. This is updating the tobacco education program. As you know, we have an event coming up May 2nd, 2019 at DY High School. And
Okay, thank you, Bobby.
Bruce has been working really very hard at this. He knows what it is. It's been a lot of work, and you've made a lot of progress with this, Bruce. So why don't you want to say something?
Yes, I can briefly update the board that going forward with the program in partnership with the schools about dangers of vaping for a program at the high school on May 2nd at 6 o'clock. You see the poster flyer that we have, and hopefully in back they can zero in on that. But it's looking very well. We do have the principal of both the high school and middle school talking, along with the high school nurse. And then we have Duffy coming in here, that was here tonight. We'll be talking about behavioralism and addiction also. Then we have a Seaside Pediatrics has a speaker coming in, and then Dr. Spillane from the hospital will be speaking also. We have a PowerPoint presentation from a couple of the speakers. Myself will be leading off with just a general overview PowerPoint, and we're looking at maybe a small snippet of a video just to educate some of the parents at the beginning. We're really trying to hold it to an hour and 15 minutes, the whole program. In conjunction with this, we do have a poster drawing that's going to be available for the middle school and high school students if they wish to participate. There's a flyer That will be going to the students and parents within the next day or so. So kids can show their creativity and be eligible to, as part of the drawing. It's really not a contest because there's such a wide range of age groups that we'll just have a drawing for. We've had very good responses from our 3 miniature golf courses and a couple of our ice cream shops that have provided gift certificates. So I've been talked to the newspapers about that, and we're trying to get the word out as much as we can.
That's 3 days from now, the deadline.
Well, we're changing it to Monday because it didn't quite make it out before school vacation with
Right.
the
Okay.
school.
Okay.
So we've extended that, so there's a new one.
Yeah, draw fast.
Yes. So we were hoping the kids would have something else to do over
Right,
school vacation, but now we're going to give them over the weekend.
Okay.
So once again, so the education program is on Thursday, May 2nd, 6 o'clock at the high school.
Yes.
And so any students or any parents, everyone's welcome.
All welcome. Public is welcome.
And people hear about Dennis, they're welcome to come as well, for
Yes.
sure, anyone on the Cape.
Yeah.
We're going to be meeting at the high school tomorrow, myself, with their IT department to see if we can also videotape the program so they can play it back on their education station
good.
or the town's education station. So we're trying to work with their IT people to coordinate the video and IT and filming and so forth.
Excuse me. Is this the first, thank you, vaping education program that you know about that's been offered for parents?
For Yarmouth, yes.
For Yarmouth?
For Yarmouth.
We've had it in other communities?
Well,
on the Cape?
Mashpee had one that they did as part of their school's system, and I talked to them, but it didn't, I don't think it was quite as elaborate. They did have a nurse speak on it.
Right.
But I don't think they had quite as
Larger program?
larger program. They did have a contest that was very successful for their posters, so I think
Good.
they had over 160. So that just means they got the message out there by itself.
Exactly, yeah.
So that's terrific.
Good.
That was a great job. Did you let the board, the chamber know? Make sure they're.
We will.
The chamber, yeah, okay. Okay. Next is the annual animal inspector appointments.
Yes. Annual inspection appointments, Amy put this together. She does every year. And our current person, Brenda Fellows, is between contracts. She had worked for us last year and was not, with the amount of travel and going back forth different hours. We're reworking her contract right now. Has not been with us. Phil has been picking it up. So I had talked to her, and she's willing to come back, and we do have some money. We've talked to the town about reestablishing and increasing a cost to the contract. So we will appoint her tonight, and then will not sign the official contract or appointment slip until we have a contract settled.
So, Director Murphy, what do we need?
You can
Nominate and approve?
Yes,
tonight?
you can approve these four as presented.
Including the second one on the list?
Not him.
Yeah, he fills in at some times.
Okay, so I need someone to make a motion. If anyone feels okay about all, then we can do it in one motion.
Yes, I nominate, I nominate all four of them.
Just give them the names for the record.
Yes, yeah, Brenda Fellows, Animal Inspector, Bruce G. Murphy. Assistant Animal Inspector, Phil Renaud as Assistant Animal Inspector, and Carl W. Von Hone as Assistant Animal Inspector.
Second.
Third, fourth, fifth, all in favor, say
Aye.
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 Aye, okay. Congratulations. Okay. Okay, we've got minutes next. Okay, this was the minutes from February 11th. Hopefully everyone had a chance to review it. Anyone have any?
There were a few typos that I apologize, I didn't get to Christina.
Right, I saw some. I
Yeah.
don't think there were any that were crucial.
Well,
If there are, now's the time.
exasperate should be exacerbate. that word. Let me see if I can find it. I looked at it without a pen in my hand. And then, of course, my name again is M-A-R-Y, not Mary. I bet you the computer does that. Let's see, did you notice that where it said exacerbate? She said exasperate.
Offhand, I don't
instead of-
recall.
Okay.
But
Make note.
I'll find the exasperate. Okay, and I'll find the exasperate that should be
Then I'll just add one more if we are doing some edits, and that's on the first page, the last paragraph. First line of it, it says potions. It's probably portions, you might guess, as opposed to some kind of potions.
No, that's not what it is. Okay.
Yeah. But, yeah, no, there's a lot of work here. It looked good to me, all right?
Yeah,
Minutes look
there
great.
were-
There's
there's a lot
There was
here.
a lot that meeting.
Right.
Thank you.
You're welcome. There's going to be a lot over your next